More and more, I'm really less interested in what the data says, but what the mother needs. That might be what the data says, but it doesn't align with what my body, my baby, and my family need. If I'm not well nourished with healthy food, not well. How many studies do we need to prove that? No one seemed to believe her. The nurses were like, "Can I get your insurance card, please?" And I was like, "She's having this baby now. Get her into a room right now." Men make wonderful doctors and OBs today, but we took out women from that process.
This isn't about poo-pooing the way it is. It's just about broadening the conversation to remind them how many options that they have.
Birth comes with a death of the old self,
Yeah.
a death of the maiden.
It's all fine and dandy. And then when you're in it, it's like, oh, wait a second. This is an experience I've never had. The idea of the moment, the pregnancy and the birth, I think is really scary for a lot of women. Hi, everyone. Welcome to the show. And today I'm joined by Carson Meyer. She's a doula, nutrition consultant, and author of her new book called Growing Together. If you've ever wondered about the real challenges of pregnancy beyond what conventional medicine tells us, this conversation is for you. Carson pulls back the curtain on topics that so many women struggle with, but really rarely discuss openly. So from things like rethinking standard hospital procedures to reconnecting with your body's natural wisdom during pregnancy. You'll discover why the medical approach to childbirth has really changed so dramatically over generations and what options you actually have during birth that nobody tells you about, and practical ways to create a more empowered pregnancy experience, which really just means a personal one and one that reflects what works for you. So whether you're planning to have children, currently pregnant, or supporting someone who is, Carson offers a refreshing perspective that combines evidence-based information with the intuitive knowledge that so many women have been disconnected from. So join us as we explore how to transform pregnancy from a medical event back into a more natural, powerful life passage that it was always meant to be. And having said that, we're so grateful that we do have medical options, but is there a way to blend the two? Welcome to the Gabby Reece Show. Let's go. Carson Meyer, welcome to the show.
Thank you. So happy to be here.
I think I've known you since you were, I don't know, maybe eight years old.
Think so.
It's always fun to watch, not only watch people grow up, but then grow up and develop skill sets, strong opinions, thoughtful conversation. And I'm really excited and proud for you about your new book, Growing Together.
Thank you. Me too.
So let's start with you. Why did you write this book? It's a lot of work. And what motivated you and what was the inspiration? What were you seeing that you thought, I'm going to roll up my sleeves and get involved?
Yeah. Okay. Well, I'll try not to make this too long of an answer, but in 2020, I started a online community and class course called Growing Together. And what I noticed in the pandemic was, aside from doulas, partners, just support people being taken out of the hospital for so many women, there was this interest and uptick in home birth. And even for those who didn't feel comfortable birthing at home, they were starting to ask more questions and realizing that knowing how to advocate for themselves was more important than ever. And I had dozens of clients that I could no longer serve because of the lockdowns and these new policies in place, who were very afraid to be going into there by themselves into the hospitals or just have their whole plan uprooted. So Growing Together was born out of this kind of concept that if I can prepare my clients for 12 weeks prior to birth and really work with them through fears, unraveling the conditioning that we all have around birth based on a culture that is deeply afraid of the process. And then also for good reason based on just how the medical industrial complex approaches women in birth, that I could send them off into their births without me and hopefully like not really even needing me in the same way. I think we all need female support in birth, or if we desire it, then we should have it, but that they would learn how to be their own best advocates with or without me there. So that was where the Growing Together circles started from. And then years later, I had my own baby, and I actually got a call from Chronicle, the publisher, the week I was due. And I thought it was like, I was like, this must be like a spam call. Is this real? Like, it's always been my dream to write a book. This is such like beautiful and funny timing. And I also believe like babies bring with them these little blessings. And so I was like, I'm about to give birth. I'm really gonna try and walk my talk of like slowing down in the next 6 weeks to prioritize that. But I would love to come back with, you know, an outline doing so. And so I wore Lou on my chest and wrote in bed and jotted things down, and they loved the idea. And I figured that if I could take the shelf of pregnancy books that I have, which take up an entire room in my house because I'm a birth junkie, and put it into one book that is, that just kind of includes everything. It's not just the data and the science or just the journal prompts, but a place where you could turn week to week to feel that connection and community and feel what I got from my community. Because not all women are best friends with a bunch of doulas, pelvic floor therapists, nutritionists. So anyway, long story short, it's that place for the all-in-one stop.
And you really break it down. Like, it's interesting because you do blend data, sort of the spiritual aspects, the feelings, and then you have it in your trimesters. Yeah. So the thing I really appreciate about the way you laid it out is it's more reflective of how life is, which is about kind of hard facts. And then, I have this feeling or I have this instinct. And especially when you're talking about childbirth and pregnancy, it's giving yourself permission. Because we live in a world that's it's physical. Yeah. And then we have these doctors and these appointments at these dates and these certain times. And so that is all part of it, this concrete, but so much of pregnancy and childbirth is about your feelings and your instincts. Yeah. And the fact that your body, mind, and spirit are involved. And you really do this in growing together. So if anyone is thinking of ever having a child, or, you know, I have 3 daughters and they're moving towards adulthood, I think this book is just important for anyone who's interested in having the conversation. Yeah.
I feel the same way. That's how, watching The Business of Being Born, I was 20. Like I didn't even think I wanted to be a mom ever at that point in my life. But that is the documentary that changed my life and set me on this path and opened my eyes to so much more in the way that the world works. And so I love that as an idea of like this being a book for young women who do not get this information.
Right. And I think you're the perfect messenger because we were joking earlier, you know, to look at you have this angelic face. But since as long as I've known you, you have strong opinions and points of view, and you do have a warrior's approach. So I think in this case, even mentioning that, you know, culturally we've sort of become fearful, or the business has become fearful of childbirth. Why do you think that is? Oh,
that's such a good question. I think there's so many different levels of where you could kind of have that answer. I think, you know, most birth obviously took place outside of the hospital prior to the Industrial Revolution. And then it became a status signal to move into the hospitals. But a majority of the doctors that were helping to catch these babies, which is the term I like to use because they don't deliver them, the mom does. But, you know, back in those days, it wasn't catching. It was forceps. It was women under twilight sleep. And so the midwife was really forgotten. And actually in the South, were the granny midwife, or the Black midwives who brought a lot of the wisdom from Africa on the slave boats. They helped women deliver babies safely, of women of all colors. And so it was, I think there's just so much in the history of the United States of like why we are where we are today. And men make wonderful doctors and OBs today. But we took out women from that process in a major way. And I think, and something I talk about in the book is like our cellular memory and our ancestral connections to our experiences. And when we look to our mothers, certainly our grandmothers and great-grandmothers, they might not have memory of the birth because of things like twilight sleep that put them under. They were very likely left alone to birth, if they were even conscious for it. It wasn't a safe environment to birth in. And so I do think that it's not that nobody's keeping this big secret from us. A lot of us don't have a lineage of women before us to turn to not have fear around it.
Yeah, it's funny. At one point, one of my girls, I was reading Weston Price, years ago, and it occurred to us with one of our girls, she might be tongue-tied. Mm. And so, we took her in. She was a little bit older, probably 2.5. The laser cut underneath the tongue, and she nursed fine. So there was no indication there. But I recently have a friend who had a baby, and he was tongue-tied, and there was a gap just long enough where her milk dried up when he wasn't eating. And it was this whole situation. Yeah. He was quite young. And someone was like, did you know that midwives in the old days had one long nail? Yes, and they would check and slice right away up and underneath the tongue.
I've heard that.
So I thought, it's so funny. We're so smart, and yet we've forgotten so much.
Yeah.
So let's, this book, it sort of redefines pregnancy and birth. It's almost, I liken it to sort of redefining back to before. And there's a perception, and it's partially true, that there is an element of risk and danger involved in childbirth. And, you always watch a period movie and the woman is screaming, and did she live? Did the baby live? Yeah. So maybe we can talk about redefining it, the pregnancy and birth, but also address the fact that it has been, and in the past, elements to it that are risky.
Absolutely. And I often say birth is life. Literally, it is the beginning, the precipice of, all that comes beyond it. And there is we can't take risk away from any aspect of our life. And so that's why I think where the spiritual element of this work does have to come in, because I think as much as we all enter this work and all want for ourselves and everyone we love to remove risk of any risk, any devastation, any of that, it will always be a part of life. It will always be a part of birth. So I think that's a really challenging thing to talk about and acknowledge. But I do think that women feel more supported when they understand that they didn't do anything wrong, right? When they experience loss in birth. And if we can talk about that and destigmatize that, then they can feel less alone in it. But with that said, of course, and hopefully most listeners are aware of the fact that the United States has a really horrible maternal and infant death rate, and that we, of the developed world, are falling far behind.
When you say that, what are some of the things that are attributing to that? Because we've never been in a more sort of technologically sound, okay, take the baby out, do this, put them on this machine. What do you think?
Absolutely.
Is it connected to our health? Do you think it starts there? And then now the environments we're putting our pregnant and birthing mothers?
Yeah, I think there's so many factors that are involved in it. And I do think it's really interesting what you point out, that as a country that spends more on obstetrics than any other country in the world, and has the access to all sorts of technology, that we are still seeing these numbers. And I think, that's what I just mentioned, has to do with the fact that it is a part of the cycle of life, that there is always going to be an inevitable amount of that. But I think, yes, what you're saying, of course, nutrition, of course, health, of course, environmental factors. And I talk about Rachel Carson in my book, who I was named after, being, even though pregnancy and birth wasn't something that, she's remembered for, I always say that she had one of the greatest contributions to prenatal care in her work for that reason. But I also think it's the way that we approach birth, and the way that we're trying to override the wisdom of the body and the wisdom of the woman and the desires of the woman. And in doing that, we take away her power, but we also ignore things that she's trying to communicate about the health of herself and her baby. And we see this with Black women. A lot of the research has actually shown that it's because of ignoring the needs of the mother within the medical system. Mm-hmm. And sometimes this looks like not recognizing pain that is actually there.
I'm feeling this way, and they just go, "Oh, it's a normal part of it." Or, "Oh, you're fine."
And there's been research that like some Black women have actually, or in studies that Black women, people believe that Black women have a higher pain tolerance, right? And so that's one example. And even like Beyonce and Serena Williams, like they've had really traumatic births that are really scary. And so what's interesting is it doesn't actually, the socioeconomic status of women who are experiencing this, it doesn't have a lot to do with it when it comes to race. And so I think that's interesting to look at with all women, of understanding that it's not so much that we don't have the technology and the information. I think we don't have the support, the understanding of really how to show up for women in this way and listen to her and hear her, and how to take birth out of the emergency
care system.
Yes. And to see it as
it needs to happen at this period of time, in this window of time, instead of putting it in an environment where we let it blossom and take however long it takes.
Upwards of 80% of births are considered low risk, right? And so those births, those women are going into the hospital system and being offered and pressured to have interventions that come with quite a bit of risk, right? Every pharmaceutical does. And so to rush the process, to introduce
like Pitocin or okay.
So to introduce certain medications, to inhibit her movement, right? To introduce a gamut of drugs, even trying to rush the process, breaking the water, so many different factors, right? And so, of course, there's a portion of women who will always need emergency care and birth. Yeah. And whether that be cesarean birth or induction or whatever it may be, but we're treating a vast majority of women as if they're ill. And I think that is a big part of the problem as well.
Yeah, that's like when you see a pregnant woman and their baby is growing, they're 6-7 months, and you're like, oh, it's amazing. And they'll say, blows me away, I'm getting so fat. And I'm like, yeah, no, you're pregnant. Yeah. I'm getting so fat. Yeah. No, you're pregnant. You have a child growing inside of you. I always used to, some days, because I never wanted to admit if I felt tired during pregnancies, because, I'm like, let's go through it. And I said to Laird one time, I go, I think I'd like to just lay down for a little bit. I feel tired. He's like, you have brains growing inside of your stomach. Yeah. And it's so funny how culturally, not only forget the medical side, we culturally have thought, one, I never think it's an excuse. So I want to, it's both sides. We've either said oh, get me ice cream and I'm just going to be over here doing nothing, or I'm just going to act like it's not happening. Yeah. And everything I think and feel is something that's my problem. I feel like we've disconnected with that, how capable we are through our pregnancy, and how much it would actually benefit us on the other side of the pregnancy if we feel well enough to move. Yeah. And hey, you know what, everybody? I just need to sit down for a minute. Yeah. Yeah. It's wild. Yeah. And
it's something, I always say it's the strongest time. It's there. Yeah. You're a professional athlete. It's something that there's just no words for what is taking place. As Laird said, a brain is growing. Yes. And so how about having reverence for the health of that process, right? Of just how, if your body is doing this, it is a very wonderful sign of vitality, right? In every way. And something I always tell my clients is, if you show up to the hospital, and I support all births, cesareans, if you want an epidural, I'm there to support my clients in whatever she needs for her birth, to feel safe, to feel supported, to feel well through the process. But I do have one rule, and that is you are not wearing a hospital gown. I don't care what you wear.
Oh, I love that. Where I don't care. You, kid?
I'm like, this is symbolic of illness, right? This gown, who wore it last, right? What were they going through in this hospital? Because not every floor is this happy. Do you feel that do you feel good in this? Do you feel powerful in this gown? And it's symbolic of our medical institution, And so even if you're utilizing the hospital, that is wonderful. But bring your own outfit or wear nothing, and you rock that feeling not like a sick patient, but as powerful as you are. And even with the wheelchair, I'll have mamas walk up and they put the wheelchair under her. I'm like, do you know what this body's about to do and is doing?
Yeah.
She doesn't need a wheelchair. Like, she has got this. And so exactly, I mean, I totally agree about like this allowing rest and slowing down and all of that. But seeing pregnant women, healthy pregnant women as the capable.
Oh yeah. And I always think like you're bulletproof in it in this time in your life in a way that you never will be again.
Yeah.
It is so powerful. So I know people really understand the responsibility or the sort of the role of the doula, but you sort of break it out and really share in the book sort of what a doula does for the mom.
Yeah.
And the baby.
Yeah. Yeah. We're there to be in service of the mother. And of course of the baby too, and that mother baby dyad. But I always like to say, whether you're birth doula or postpartum doula, I like to support the mother so she can support her baby. Mm-hmm. Right. And I think that's what sets birth doulas apart from night nurses and other, support people is, ideally a mother feels held enough and supported enough and well nourished and fed so that caring for her baby in those early weeks is a no-brainer.
Yeah. How do you, when you first meet a mom, what are some of the questions? Because these questions that you're asking, and you talk about sort of setting that table in the book, but what are the things you highlight? Because I think a lot of women are pregnant and they never even think to themselves, oh, how do I want that? Or how do I feel about this? You
mean of the choices that they have?
Yeah. Like when you meet someone, maybe just share sort of the beginning of these conversations, and then I want to get into some of your activities.
Yeah, we go pretty deep in the Growing Together courses, and the book outlines and includes a lot of that framework. But I have my home and hospital mamas learn about what is offered in the hospital, so what they can access if they desire, and what they can opt out of if they desire. And so we really go through and look at all of those. I try and provide as much data as possible. But as you mentioned earlier, and evidence-based birth is a wonderful resource for those listening that I love to pull from. It really helps provide like digestible research for parents and for myself. But more and more, I'm really less interested in what the data says, but what the mother needs. And I think that's coming back to what we were talking about. Like, that's where we've lost our connection with it, is like we've become like the data orthodoxy, right? This like obsession with science and data that is so important, but has also detached us from the innate wisdom of our bodies and our desires and our ability to say, I recognize that might be what the data says, but it doesn't align with what my body, my baby, and my family need.
Yeah, I think this is probably a golden rule to live by, which it's even those times where you go, hey, this may not even make sense to you, but this is how I feel. Yeah. This is what I need.
Yeah.
And giving yourself permission, especially when you're pregnant.
Yeah.
Because this is your particular precarious environment, and you are responsible as much as you can love the partner and all of these things.
Yeah.
And also I think especially if it's your first child and you've never done it before, it's all fine and dandy. And then when you're in it, it's like, oh, wait a second, this is an experience I've never had.
Yeah.
And the end of this experience, never mind having a child that changes your whole life. The idea of the moment, the pregnancy and the birth, I think is really scary for a lot of women.
Yeah.
This podcast is brought to you by Live Good. You've probably been hearing the buzz around methylene blue. Everyone's been talking about it. It's a way to boost your brain power. So I even did an entire show on methylene blue. And what it is it's a powerful neurotropic. And it's designed to fuel your brain and keep you sharp. And this is amongst other things. Methylene blue does a few things. But here's the thing. Not all methylene blue is created equal. And Live Good is committed. They are making the highest quality, ultra pure methylene blue. There's no fillers and no junk. Just pure brain boosting power. Who doesn't need that? I'm not kidding. So while other brands mark up their prices, and it's hard to incorporate these kinds of things into your life because it gets so expensive, Live Good is committed. They deliver the highest quality methylene blue, but it's for half the price. And for me, this is really important. Ingredients first, but how do we make it realistic? So if you want to stay sharp, think clearer, protect your brain, and have more mental clarity and energy, Methylene Blue is for you throughout your day. You definitely will enjoy their product. It's so easy to use. Live Good Methylene Blue. They have a great offer for you right now. You can get 10% off your first order, and that's off of anything you get. They have so many other beautiful products. They have great omega. They've got protein. They have it all. So all you have to do is go to livegood.com/Gabby. That's livegood.com/Gabby. They have so many other things to check out, prices people can actually afford. Go to livegood.com/Gabby and get your Methylene Blue today. So when you have a patient, and let's just start with nutrition. Let's say she's just a hardworking person who sort of eats this and that. Maybe she's not on it. In what ways, as you move through pregnancy, how do you have the conversations around her nutrition, and what do you find people do too much of that they might want to avoid, and what are they not sort of getting enough of that they might want to focus on?
Yeah. So around the same time that I started growing together, I realized this was also a gap in my work, was nutrition. Because as somebody who, when I turned 18, I my mom, one of your dear friends, very passionate about food, nutrition. So I was very fortunate to have that background. Then I met a doctor when I was 18, a naturopath, who I'm every day, like, just have so much gratitude for what he
because you had your own things you were navigating.
I had my own things, and through nutrition, there was information that I, even living in Los Angeles, this was over 10 years ago, but I had no idea. And he set me on a path for my health that I will just really be forever indebted to him for that. And so that sparked an interest in my own personal life around nutrition. I navigated eczema when my parents divorced.
Yeah.
And that was how my body responded to it, was the emotions. It brought up eczema, and through the GAPS protocol, through food and nourishment, completely was able to heal myself through that. So food has always been really important to me. And I started to recognize that my clients were not having these conversations with their doctors. If they were, it was 30 seconds. There was, just take a prenatal. Anyone's fine. Take a prenatal. Like, that would be the extent. Or the gestational diabetes screening, which we can talk about, is also in my book, which is horrific. And that was it. So I got certified as a nutrition consultant so that I could feel more confident in having these conversations with my clients, because I know that good nutrition, pre-pregnancy, in pregnancy, postpartum, which is a whole other amazing topic of how we can completely transform that experience through food. You can set someone up for success when they have that information and those resources.
So somebody comes in and they go, listen, Carson, I've been busy. I haven't been great. In that moment, is that fine enough? Like, because I know a lot of people think, well, when I conceived, maybe I wasn't in the tippy top of my shape, or I was still, drinking some weird frappuccino, or who knows? Yeah. Are we seeing that, hey, it really can make a significant difference, right?
To change right away.
Yeah.
Absolutely. I think it's never too late to get healthy. I really believe that. I get this question a lot around morning sickness, right? Or all day sickness, where women will get pregnant and then be like, I'm eating a bagel and that's it every day for 10 weeks or whatever. And this is all I can really stomach. And obviously that's not ideal. We know that. But women who experience severe hyperemesis can't keep anything down. And so I say, we're working with what we can in this moment and doing the best we can in this moment. The body is so resilient, and that's such a powerful reminder. And more, even though I'm very passionate about nutrition, I also think that there's a lot of energetics of how we approach food. There's so much beyond that, and we can fall into these same dogmas with food that can actually become unhealthy. So I try to work with let's not add stress to the situation and shame, work through that. Let's try and find a prenatal that you can stomach and work through that. And remember the wisdom of your baby, who is pulling from your reserves and who will make sure it takes from you whatever you have stored from prior to this season. Right. And then when you're able to pass through that, to get to a point, we are going to work on replenishing you so that you can have a good breast milk supply and, and you can feel nourished and strong postpartum. So yes, absolutely.
Is healthy fats and protein, are those the things you focus on? Because, well, first of all, are people a lot of times, is it straight genetics, or is it because they took their prenatals on an empty stomach and those things are strong? And how much of it could they just, if they ate a little bit differently, it would
for morning sickness,
alleviate morning sickness? Absolutely.
I work with women all the time and I see just diet changes being a huge,
give me one example to another, just so.
So it's this funny, not funny, but a kind of awful vicious cycle, right? Where eating makes you sick, but not eating makes you sicker.
Right.
And the reason why it's called morning sickness is because for a lot of women, they're waking up after that long fast and their blood sugar is wonky, and that's what's creating the morning sickness. So we know that balanced blood sugar is a huge part of feeling better in pregnancy. And if you're, like you said, more proteins, more fats, able to have balanced meals, keep that blood sugar stable, so greatly improves it for a vast majority of women. There are some women who I've seen where it's just, we don't know. Is it genetics? Is it, and we know so little about it. Maybe it's heavy metals, maybe it's toxins, maybe it's really unknown, but I absolutely have seen improvement. And I know from my own pregnancy that the way that I was nourished, I know is why I felt okay in that first trimester.
Yeah, you also had a real advantage.
I'm very fortunate. And
the look in your daughter's eyes tells me that too. Yeah,
my husband's an amazing cook, but bone broth, things like that, right? Which was just making sure that there was always bone broth flowing. I kept chomps by my bedside table. I would eat through the night to make sure that my blood sugar wasn't getting too wonky. I would have a hard-boiled egg at 11 p.m. before going to bed. And so, there's absolutely things you can do. And I know for women who are listening, who are experiencing that, or you're crazy, eggs, no thank you, I can't keep that down. But I think if you can at least try to incorporate some of those foods, you might actually get out of a cycle and into
something that the upcycle. I think that impacts a lot of women. I didn't have to deal with that.
Yeah.
But talk to me about, because you had a passionate response to that.
Yeah. That was something I really learned about in my own pregnancy as well. Of course, we're working with clients, but it was really, it was one of those things that going through it myself was really helpful in helping my clients. First of all, the screening for gestational diabetes is to drink a orange drink, soda-y looking thing. I mean, I wouldn't touch.
It almost looks like dial soap.
I wouldn't get close to a drink that color.
Yeah.
With a 100-foot pole. It is, So that, the food dyes in there, all of the ingredients, there's actually ingredients in there that is banned in some other countries, right? So just the irony of us giving a pregnant woman a drink with the amount of sugar and crap that we would tell her to stay far away from every other day of her pregnancy, but this day is different than all other days. So that's the start, right? And so for women who do want to go the conventional route of testing, knowing that there are alternatives to just not having to get anywhere near this drink. The fresh test is one that's gaining popularity. Some people bring jelly beans or orange juice, right, to try and spike their blood sugars in other ways in taking this test. The test itself is quite unreliable. So there's a lot of false negatives and positives that happen. I see this a lot in my work. But also I find that the healthier the woman, the more likely she is to get that false positive, because her body is like, what the F did you just do?
Yeah.
What did you just make me consume? I'm not quite sure how to handle this. Right. And so a lot of very nutritious women that I work with are nutritious women. I don't know if that's correct.
No, they're just healthy, nutritionally healthy.
Nutritionally healthy women.
Down the system that it hasn't experienced.
Yes.
Yeah. You're saying you could get this false positive. Someone's healthy. They've been doing, good work with their food and movement, and they get these false positives. Because then what happens if you get the positive? Then what?
Well, there's retests that usually you can try and troubleshoot through that. But if you want to avoid spiking your blood sugar that way and feeling like crap that day, I've had clients have to pull over on the side of the road because they feel so shaky from what they've consumed and on an empty stomach. And if you don't want to consume whatever is in those drinks, like I said, there's those alternatives. But then there's also the alternative that is the route that I took that was so helpful in understanding more than just one little snapshot of my blood sugar. And so I did a at-home test. I went to CVS. I actually ended up, I got like a blood sugar monitor at CVS, and I found that it varies with the reliability of certain tests. So I did end up finding one that was a little bit more reliable. That was on Amazon. So something that everyone can just do at home, get the strips and prick your finger when you first thing and you wake up in the morning to see what your fasting blood sugar is. And then test an hour and 2 hours after eating with every meal. And in doing this over a week, you can really get to understand how your body is processing food, sugar, glucose, right? How our body is responding to the foods we're eating. And a lot of people think, okay, I don't eat candy, so it's fine. But a lot of people don't know that maybe sweet potato, right? Or rice with
popcorn.
Yeah.
I love popcorn.
Yeah.
It's so sad when you realize. Do you ever have any of your clients? I know you're doing less now because you're doing other things, but did anyone ever wear a glucose monitor to get more in touch with it, or is that sort of unproductive?
Yeah. So, I mean, definitely some people utilize the glucose monitor. It's not something I've really tried.
Okay.
I do think sometimes we can over obsess with numbers, coming back again to enjoying food, enjoying life. And so I think this week period, for some 2 week, really understanding is super valuable for those who are pre-diabetic, have gestational diabetes, or diabetic. Like obviously this technology is life-changing and so informative. But I'd really say, like, take this time if you choose to learn about how your body's processing food, and then eat healthy and enjoy and check in if you feel fit. So it's not something that I recommend doing continuously throughout pregnancy. But I know that many have like thrived from it.
Yeah. Well, I think for certain people, if they can gamify it, or it's sort of the way that they stay aware, that's fine. But, Laird always jokes, more experience, less data.
Yeah. And in pregnancy, I see this across the board, and with ultrasounds, with everything, right? It's because of this fear, because of our cultural obsession with numbers. Women are just, everyone, right? We're just trying to grasp onto some sort of number, some sort of rule to follow, some sort of instruction. And this is what I talk about in my book, right? It's like how we can step away from that, tune into how we feel, and utilize those numbers and those tools when fit, when necessary. But there's overuse of technology happening all the time. And I think it absolutely disconnects us from ourselves, from our joy, and from being present, and enjoying a meal.
Yeah, in pregnancy, like, listen, if you decide you're going to do it, you're lucky if you do it once, maybe you do it twice. Some people do it more. It's like, it's this once in a lifetime experience, possibly.
Yeah.
And I think to be in it, and not to have a ton of dread, because it already is. It's so overwhelming in so many great ways, and in some scary ways, this unknown, that the more you can listen to yourself, I think that idea of that's how you're entering into parenthood.
Yeah.
Because that's kind of all we have,
and
right?
the apps, I mean, we see this all the time, right? There's apps marketed to mothers. There's machines. There's monitors. And so I do think that those can fall into the same category when we abuse them, right? And it's like about just keeping that in check.
Yeah, I'll have friends and they go, well, my kid, they're not talking. I go, listen, why are you saying that? Are you comparing that to somebody else? And I love when you meet them and they go, oh yeah, they're in the 95 percentile. I go, you're 5 feet, your husband's 5'6", your kid is not going to be 6'7". Yeah. I don't, I'm joking, but it's sort of like, why do we do that? Yeah. Good and bad. Yeah. All of that. So if somebody goes, hey, listen, I know I'm going to be a person who is going to be in the hospital versus a home birth, and then we'll go there. When you have a client that's what they're going to do, what would you say going in, when they're going into their checkups and finally into the hospital? How can they fortify themselves? How can they know the questions to ask and things to say? I think it's you're especially after you have your baby, you're tired. Yeah. And you're going to have some other, everybody gets a birth plan. supposedly, right? And and then they change it, and then all of a sudden you're exhausted, and they're sort of like, do you want to keep your baby safe?
Yeah.
Do you want to give them this? Do you want to give them that?
Yeah.
So how do you sort of have the conversation of a patient going into the hospital versus someone who says, I'm really going to explore and get prepared to have a home birth? How do you do both?
Yeah. So this is where that 12-week course really changed how I worked in such a meaningful way, because these conversations and these discussions and this preparation really does have to happen before, like you said, right? Not in the moment of labor or right after. And I do hear people say a lot that they don't want to attach to a birth plan or over prepare because they don't want to be let down, because birth is like life, right? It flows, and sometimes we end up in places to birth that we didn't want to be birthing, or the birth experience is not what we maybe desired. And so as much as I can resonate and relate with that feeling, I do think it's really important that we don't use that as an excuse to ignore these conversations prior, and to really think about it. And I don't use the word plan because I think that can be misleading, but we call it birth intentions, right? Like, what are our intentions? What are the things we want to learn about? And creating that birth plan or birth intentions, I think, is a helpful roadmap for clients. And this should always look like conversations with your midwife and your doctor prior to your birth. And sometimes it looks like switching providers, which is not fun to do in pregnancy, but I do think it's important to make these changes and set yourself up for success prior to your birth, so that it minimizes the hard conversations having to happen.
So what does that look like? Because I think a lot of people wouldn't even know that that's
an option.
Yeah.
Yeah. Here's another kind of
you can just
maybe
say
unpopular.
You can just say it, Carson. It's okay.
There's a certain...
You're going to have somebody who works on car engines telling you, what do you know about childbirth? Don't worry.
I think that something we also have to remember as women and remind other women, which is, we've all been there. I know you have, I know I have, is that we are sovereign beings at the end of the day, and we can feel backed into a corner. We can not like the options. We can feel poorly resourced and be poorly resourced. But at the end of the day, we always have choice. And I think that there's something profoundly liberating in taking full responsibility for our lives in that way. And like stepping out of a victim mentality. And I'm not saying that abuse and trauma and all of those things don't happen to women. That's not at all what I'm saying. But I hear women say all the time, I didn't know I could change my doctor. I didn't know I could say no to that. I didn't know I could leave the hospital. I didn't know, right? And so if there's one thing I want every woman to know, is that she's not a prisoner in any situation in her birth. And it's really freaking hard. So I'm also not making light of that statement to speak up in a vulnerable time, but we have that power.
Right. You're equipping them.
Yeah.
So a lot of times doctors, some are more open to having a midwife, and others are like, oh, it's a huge inconvenience to me. What is that? How does that usually show up?
What part is the inconvenience? You mean the
midwife? Like, I wonder sometimes if doctors feel infringed upon.
Like having a doula there or midwife there or something.
Yeah. What is that? Are they usually?
So I've had clients, one of the most incredible doctors, Dr. Fabi, who actually wrote a blurb for the book and has been such a wonderful supporter and somebody. So there's so many incredible doctors out there who I am just overjoyed to know that my clients are working with, who really do honor women's right to choose in this, and be the center of this experience in a meaningful way. And so it's not necessarily always like a doctor or midwife thing. But what I will say is, when a client tells me that their doctor does not want them to have a doula or doesn't like to work with doulas, I'm like, this is a really, really big red flag that you should be paying attention to. Because what does that mean, right? Let's break that down. Doulas are not evidence from evidence, but there's evidence that supports doulas. Having a doula can lead to better birth outcomes, higher APGAR scores for babies, less likely lower cesarean rates, less likely to need Pitocin, labor augmentation, pain management, medical pain management. So there's a lot of benefits to having a doula. And your doctor, if your doctor's just dogmatic about the studies, then your doctor should see that and recognize that there's evidence that supports you using a doula. Also, if there's whatever you want to feel supported should be embraced. Nothing to do with like my ego as a doula, but if your doctor doesn't see the benefit in that for you, then maybe find a new doctor who wants to support what you want.
This podcast has been brought to you by Bond Charge. I've been using my red light face mask for, I guess, about a year already, and I've noticed a difference in my skin. I want you to do all the things. I want you to exercise and eat well and get to bed. But these for me are the nice little perks where if I'm feeling tired, a little run down, I can just put it on. So easy to use, cordless. I can sit at my desk and do it. 10 to 20 minutes a day really makes a difference. It's so easy to use. And red light has shown it can boost collagen, reduce fine lines and the appearance of, that tired kind of drapey skin, make your skin kind of more youthful. And if you have blemishes or even some scars, it's supportive of that too. So if you've been curious about a red light face mask, this one will impress you. All you have to do is go to bondcharge.com/Gabby. That's BONCHARGE.com/Gabby. And you will get 10% off your entire order. I also have a sauna blanket, got some headphones from them. But if the red light face mask is something that's been on your list, now's the time to do it. They'll give you free shipping and a 12-month warranty at bondcharge.com/Gabby. This podcast has been brought to you by Maui Nui venison. I got my first thank you gift box in the mail probably about 6 years ago from my friend Billy, and we got it as a thank you. And then we became customers right away. So we've been customers for 6 years because I'm sure like you, I do want to find the best quality protein. I want to consume it. I want to give it to my family, but I want to do it in a way that I can feel good about. And Maui Nui venison does that. So talking about the quality, even compared to some red meats, 53% more nutrient dense. But feeling good about the source of protein, it is literally the only wild harvested meat on the market, completely wild harvested. So all those boxes are checked. And then finally taste. It isn't gamey. It's really clean. I even find because it is so nutrient dense, I eat a lot less of it. It's like my body almost knows like, hey, you've got what you need. You don't need to eat a ton of it. We use medallions. I throw them on the barbecue, got ground meat, just however you want to use it for you or for your family. So simple to use. They get it to you simply. And if you've been curious about trying it, all you have to do is go to MauiNuiVenison.com. Oh, and by the way, they've got bone broth and beef sticks. So for example, in their beef sticks, 55 calories, 10 grams of protein. So really great. If you're on the go or in between meals, maybe you're traveling, they have you covered. So if you go to MauiNuiVenison.com, MauiNuiVenison.com/Gabby, this will give you access to hard to get qualities and cuts of meat that me and my family are using. That is that right? Me and my family? Yes. My family and I are using. So all you have to do is head to MauiNuiVenison.com/Gabby. What are the options for somebody doing it? Let's just call it the conventional route. Like I'll use myself personally. I don't care. On my last birth, do you want vitamin K in the eyes? And do you want Hep B, I believe? Yeah. And I didn't feel compelled to have either. And so I didn't. And, there's a moment of, and it wasn't my doctor, right? It's the pediatrician. I couldn't be here with my regular pediatrician because of the fires. I was in Maui. And so it was a pediatrician who was there. And he said, well, let me give you my spiel, talking to me about Hep B on a, 24-hour-old person who I was nursing and planning on nursing to the best of my ability. Well, you don't know who's going to be handling your baby and the threat. And I remember thinking, if I was a first-time mother, I was a single mother, I was maybe raised a different way, I would feel guilt and shame and all these things to succumb. And one, I was getting pissed. But second, I just said, okay, well, what you can do is you can go ask the dad, and whatever he agrees to do, I'll do. So I bounced it to Laird because I was like, I'm not going to deal with your bullshit right now. Like, I'm going to say how I feel. And then after that, so what can a lot of women, and I know it might be a little different state to say, anticipate needing to answer about, you know, what they'd like to put in the baby before you go home or on the baby?
Yes. So you mean like the actual, these interventions?
Yeah. So people understand what they're
going to offer.
Correct.
Yes. So, and I love this question. I'll get more specific on that. But I think ultimately kind of going back to the last one is like, they need to have what you're saying, a strong connection with their first and foremost. Yeah. If that's what they're wanting to do is opt out.
Yeah. And right after you had a baby too, which is, you're not tired at all.
Yeah. But I do say that this is a rite of passage. Birth is an initiation. And it's not going to be the last time you have to advocate for your child, and not going to be the last time you have to make hard decisions about all the things parenting. And so I always think it's actually this like blessing. Not that you have to think about this in your postpartum sacred bliss bubble, but like reframing it as this like gift to be able to practice being in your power.
Yeah.
But to answer that question, there's 3 interventions that are recommended right after birth. One is the erythromycin eye ointment, which is an antibiotic in the eye. One is the vitamin K shot, and the other is the Hep B vaccine. So these are recommended across the board, but all, of course, options. The eye ointment is to protect against blindness for babies who are exposed to STDs in the birth canal. These STDs can be screened for, so we can rule them out, which is really wonderful. And we can know that some babies will be at greater risk than others. Antibiotics are not harmless. We know that. That's become mainstream information, right? That like overuse of antibiotics, whether it be allergies, resistance, the overuse, what it does to the biome. So even though people just are like, well, it's just better safe than sorry, do it across the board. I think we're learning like it's not better safe than sorry. Of course, if this child is at risk of becoming blind from this exposure, how glad are we have antibiotics.
Right.
But for every single child to get antibiotics in their eyes at birth, I don't think we've really studied or understand the implications of that.
Yeah.
Aside from the fact that it's, I actually had a midwife friend put it in her eyes because she's like, I want to know what it feels like if I'm going to do this to babies. And she said it stung.
Yeah.
And also the gooiness. Babies don't see a ton to begin with anyway, but we are impairing their ability to see mama. The vitamin K is not a vaccine. It's a shot that does contain preservatives and other ingredients that may be of concern, but it is to give vitamin K, which we don't really know why babies have low vitamin K, if it's a deficiency, why the placenta. Yeah.
Maybe they didn't need it yet.
Yes. And that's something that a question we ask.
The thousands of years before we had our vitamin K, but now all of a sudden we need it.
So that's definitely a wonderful
But Hep B is my favorite
thing to, And so really quick with vitamin K, evidence-based birth is a great resource for like really going through the studies on that of like, if your child's at risk, this being an intervention that has shown through the studies to improve overall health outcomes. But for babies who do not have a blood clotting disorder, it doesn't make a difference. Right. And so there's that.
So you can basically prick your baby's foot and make sure that they can stop bleeding on their own. I mean, that is a test that I was comfortable with in the hospital.
Yeah. And that's the thing with vitamin K that I think makes it one that is a harder, like not as much of a no-brainer as the other two, is because you can't always know, what your baby might, what genetic, there's concerns there that could make it a life-saving intervention for a very, 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 very small percentage. And we don't know if the baby has experienced any internal bleeding from the birth. Again, these are very rare and unlikely situations. But again, they just give it across the board to protect that small group. Yeah, that small group. But The Hep B one, very different.
Wild.
Because we can rule that out in the mother and in the father, right? Or whoever else is going to be in the home or caretaking for that child. This one, I wish I had better answers for.
The guy said to me, he goes, well, because, it's dangerous. You don't know who's going to be, caring for your baby. I go, well, actually, I do know.
I do. Yeah, I do know. So and let's also back up.
Yeah.
Sharing bodily fluids with the baby is most important because Hep B is a blood.
Yeah. Yeah.
It's bodily fluids. And that's another thing. You don't breathe on someone and give Hep B. And
right.
So
it's sex. And
yes. Right. And the transmission could of course happen from mother to child.
Yes.
But if we're ruling out for that,
right,
then what is?
So it's a great solution. It's like, hey, if that was an important solution for something that needed to happen, it's there. Yeah. But there's things you can do way before that so that you don't have to cross that bridge when you get there.
Yeah.
So I think that that's just important for people to know. Now, if someone was like, I'm going to do a home birth, what does that look like? Like, get the tub ready and here we go. Like, what's the planning around that and who's there?
Yeah. So in my book, I break down the different types of, how birth looks different based on your location and also the support that's available to you, be it a midwife, an OB, or even for some choosing to have a free birth without the support of midwife. And then also the different types of midwife, right? There's nurse midwives, lay midwives, there's a lot to choose from. And this really varies state by state. But yeah, home birth, most women choose to have a midwife with them to support them in the birth. And so I think one of the beautiful things about home birth is that they come to you. So I often say getting in the car is an intervention because your primal self, whether it be traffic, the discomfort of being in the car, parking, right? Going to a new environment is, it can really activate the part of the self that is protective of the baby, right? The cortisol, the adrenaline, like these hormones that can actually stop labor for a brilliant reason because your body's not going to release a baby in a feeling unsafe. Yeah. And so most people feel really safe in their homes. And so to have someone come to your safe place where they're a guest in your home. Right. You get to call the shots. And I think that there's something mentally, as we talked about, of when you're in your home, you feel in your power, right? When you go somewhere, when I'm here, I'm like, can I have some water? Can I use your bathroom? And so I think women feel that way in the hospital, right? Can I touch this? Do I do that? We want to be a good guest. Yeah. And so I do think that just, one of the many reasons that like for home birth is like for women who it's a good option for, they feel really in their power there.
Yeah, they can ask for what they want.
Yeah, it's their cave, They feel good there. I know for me, it's so interesting having like given birth after many years of supporting both. Yeah. And oh my gosh, I mean, first of all, I prayed. I just kept visualizing, praying for an ambulance to come take me to a hospital to get me an epidural. I was so unhinged. I was like, was so humbled.
Was it the discomfort?
It's just the intensity of the experience. I gave birth at home. I loved it. I mean, it was my dream birth, but get me to a hospital. I want an epidural now. I was it was really, it was intense. It's just like, it's such an intense feeling. So, and that's something you don't get at home is the epidural, right? And so that's, I think, also why so many women choose to be in the hospital. But what I will say is what got me through was this ability to move. I want to be in the tub. F the tub. I'm getting in the bed. I'm getting there. I want to be up here. I'm on the toilet. I'm in the shower. I'm standing like this. And nobody told me where I could go, where I could sit, where I could be, what I could eat, where I could move. And I could just be fully present in whatever my body and baby needed. I remember at one point, my midwife, who I just loved so much, she was like, what, do you want to try this position? And I was like, I'll kill you. Don't talk to me. Don't even suggest that I would do something different than what I'm doing right now. And it was with such kindness and love and attempt to help. And so you see women in the hospital who are, you have to stay here. You have to monitor here. You can't go there. We can't go to the bathroom. It's a liability to move here. It made my admiration, which I already just have so much for all my clients, whether they're have an epidural, whatever it is, I'm always just completely in awe of the strength and resilience of women in birth. But those who had opted out of an epidural in the hospital, I would not have been one of those. There's no way I could have accessed any sort of comfort with those limitations.
That's a good point.
Yeah.
It is. We've been like, even the birthing table is really for the convenience of the doctor.
Yeah.
Right. You're not working with gravity necessarily. Yeah. It's just easier than you have to bend down.
Yeah.
So I think this isn't about poo-pooing the way it is. It's just about kind of broadening the conversation to remind them how many options that they have.
Yeah. And some women love birthing laying down.
Yeah, sure.
Right. Like that's the thing too.
And they might too, but it's just, you
it
have
should
the
always
choice.
be on their terms.
Right.
Yeah.
And I think that's the thing is, weirdly, around things that are medical, and I'm putting it up there, and we'll put childbirth in there, especially once you move it into the hospital, not as an extension of life, but medical, is there is weird shame or guilt if you don't go along with the status quo.
Of course.
And so I think it's so important to just remind them that you're not there to make friends. And if your doctor gives you that look and he's disappointed, it's like, who cares? You know, like seriously, who cares? So first birth you ever saw, what was that like for you?
Oh my gosh. Well, it was a second time mom. It was very fast. And it was amazing. And she was giving birth in the hospital. And I remember she hired me saying, I really want an epidural. So I was like, great, I got you. That's your job. Go get me that epidural. I was like, I'll get there and get you the epidural. And second time moms, sometimes the baby comes faster. Sometimes they don't. Yeah. But she had taken some castor oil.
Oh.
And she was things were moving. I'd never seen a birth before. I just had read all the books.
Were you scared?
I wasn't scared, but the urgency of that birth was a big initiation because we were in traffic at 5:30 p.m. going, down like La Brea or whatever, trying to get to Cedars. And we finally get up and she's like, and I'm like, I don't really know what to reference from this, but and she lays down on the floor when we get to the lobby and is like, the baby's coming. And no one seemed to believe her. Again, going back to the baby, none of the nurses were like, can I get your insurance card, please? License, and I'll check you in. And I was like, she's having this baby now. Get her into a room right now. And they finally get her into the room. And I'm like, and she needs an epidural. She wants an epidural. That's the one thing she asked for. She wants baby flies right out. And she's like, my epidural. I was like, I'm so sorry. But her baby came so quick. And it was funny because she didn't believe that. She had a long first labor and she really didn't want to. And so I do feel like I was able to drop a lot of what people had told me. Even my mentor at the time, there was a woman who was supporting me who had more experience, was like, have her stay home as long as possible. And I said, I just don't think we should do that. And so there you go back to like the intuition. Like we really just followed that and got there. And it was beautiful and it was fast and wild. And I remember being home, like very quickly. And so that was unique. But the other births that I attended within like the first few births were out of the hospital. And I always say that was a really unique and helpful way to begin my career, because so much of us, and myself included in my experience, are brought up as doulas within the hospital system. So what we see there becomes normalized. What we learn from how it's done there becomes what we know to be true. And so I had this gift of being able to support home births and watch how midwives work and challenge some of those ideas.
Yeah. And they'll let you bring your own robe, huh? You can wear your own robe?
Yeah. Or whatever you want. And even for those who want...
Taking all these weird surgeries and childbirth and that paper ass out in the back.
Here's when they might tell you too that you need a robe is if you want an epidural, but they sell ones that like go down in the back. So if you want an epidural, you can still opt out of that robe.
Just get a sexy robe.
Get a sexy robe, wear nothing. Yeah. What
do you think are just very common misconceptions about birth? Maybe it gets, it's funny. I used to watch movies before I had kids, and when coochie coo, and they would tap on the window with all the babies in the room.
Oh, yeah, the nursery.
I used to think that was so cute. Then I had my own baby, and I was like, why are those babies not with their mothers? Yeah. It's so funny how it shifts. So we're sold how it is, and the way it's supposed to be. What do you think for you from the way it's intended and it's in its sort of essence versus some places we've arrived?
Yeah. Well, you mentioned that Hollywood depiction of birth, which I think we're all so familiar with like the flailing legs and the screaming woman and the blood and the scary man like over your head and that the lights, and that I would say is the first thing that we can challenge, because it's rarely like that. It does not have to be like that. And then there's actually physiological benefits to it not being like that, right? Because the hormones of labor are really important to support, oxytocin being a huge one. And for those of you who aren't familiar with the oxytocin hormone, is the love hormone. It's sex, right? It's family, it's love, it's connection, it's bonding, it's intimacy. And so thinking of how we can bring more of those things into the birth space is not just woo-woo. It's not just for feeling good, having a photo op, but really because the oxytocin hormone is the one that's facilitating the contractions. It's facilitating the milk letdown. It's helping to bond us to our baby. So there's so many benefits in seeing birth through that lens. I guess another misconception, you mentioned that nursery, right? And for those who do give birth in the hospital, one thing that you aren't really able to do is the co-sleeping right after birth and sleeping in bed with your baby after birth in the hospital.
I did. I mean, one
did
time
they come in and say, "Gotta put the baby in the bassinet"?
No, nobody told me anything.
Okay,
just pee and then you can leave. But for me, I do remember though being, you're so tired.
Yeah.
I think it was maybe Viola at one point, you sort of think she's lost down in the crack somewhere.
Well, I mean, maybe we'll cut this if my poor mom doesn't want this story, but my mom tells me this all the time, is she was like, I had you there because I wouldn't let them let you go.
Yeah.
And I woke up and you were in the crack there.
I think I did the same thing.
I still have guilt because you rolled right off. I was like, thank you, Mom.
I think I had the same thing, but no, I didn't want to be separated.
Yeah.
Not at all, but and listen, and this is the important point. I'm me, someone else is them. If somebody goes, "Hey, I can't sleep," and the baby's sleeping and I need to sleep, we're going to put the baby in the co-sleeper. Hey, do what you have to do. It's your family.
Yeah, of course.
But I just think it's knowing that you're going to have nurses bully you all day long. And it's like remembering, wait a second, it's my kid.
Yeah.
I'm going to hold the kid. Do you have to stay in the hospital? You know how they say, well, after you pee or whatever the litmus is, you can go home. Or is it, could somebody say, I'm feeling good. Maybe they have their kid early in the morning.
Yeah. Can you go home at that?
Go home that in the evening. So, is that possible?
From my understanding, this may differ like different hospitals, but generally with cesareans, it's 4 days or 4-night, I believe, stay. And then 2 for vaginal birth. What we saw in COVID, which was fascinating, was they got the cesarean births out in 2 days and the vaginal births out less than that. On one hand, I don't love this idea of women who have had a major abdominal surgery feel like they're kicked to the curb right away after birth if they're not going to go home to support.
Right.
If they can.
That's a very good point.
Yeah. So that wasn't like a great thing. But what it did tell us was, I don't actually need to be here for 4 days and nights. Maybe I'll actually do better at home if I am supported. So that was, for some, there was definitely benefit to that. I don't think many women get great sleep in the hospital after birth or feel super comfortable there and are eager to go home. And if that's you and you feel good and you are ready, in order to leave, to get the like your OB to or midwife to, say you're cleared to go, but also the baby's pediatrician needs to see the baby. And so this is when picking a pediatrician may be important. Some are using the hospital pediatricians, but if you give birth on a Sunday morning, do you have a pediatrician who's willing to come so you can get home? Or, you give birth on a Saturday night and or maybe there's an extra fee, but that is where I see there be challenges. But as long as the pediatrician and the OB kind of give these thumbs up, then you can, should really go home when you feel you can. I mean, midwives leave, I don't know, my midwife left like 4 hours after I gave birth.
Really?
Yeah.
Oh, wow.
Yeah. Everything was great. The placenta was birthed. We were latched and it was I gave birth as the sun was going down. So it was a beautiful thing of she got me a bowl of lentil soup and put my sheets in the wash, made sure my bed was clean and it's on her way.
Yeah. I had a C-section and I stayed one night.
Wow.
Get me out of here.
Wow. Yeah.
I just sat up on my elbow and Laird would give me a push out of bed,
Yeah.
Quite frankly, because it was more healing for me to be at home.
Of course.
But I will say, if anyone's listening to this and then for some reason they have to have a C-section, the way you feel on the 4th and 5th day is significantly different than the way you feel on the first day. So and
some who have 3 kids at home, they're like, I'm going to milk this.
Oh, hell yes. I would too.
I'm going to milk this.
Because then, can you pick me up? Can you do this? It's so I think that's really an important point is sometimes that might be the better place.
Yeah.
How does childbirth differ in the US than in some other countries? What are we doing? Because some of it could be so much better, like we're talking about. What are some of these differences?
Man, I think there's countries that really embrace midwifery care, which I think is a main difference, where there's some states where midwifery is actually not legal in the US.
Really?
Yeah. So they're not actually recognized. In California, there's you can become a direct entry midwife, so you don't have to go through nursing school. But in other states, primarily in the South, you're only recognized as a midwife if you've gone through nursing school. So even that, right? Like midwives are not always easy for women to find, to be supported by. And then in a lot of other countries, midwifery care is the predominant care for low risk pregnancies.
Are you surprised? Like if you think about your life, you grew up in a unique way, that you ended up here talking about this. And the reason I ask that is because you could have done a million things. What is it about this topic that you're dedicating yourself to?
Yeah. It's one of those, when I discovered this work, I was in college, but I was really passionate about acting, and I thought that's where my life would lead. And then, like I said, it was Business of Being Born, seeing that film, which opened my eyes. And I do think similar, that's why we just, when we get together, it's like we could talk for hours, because we share this passion for health, this is really just a lane of that bigger conversation around all the things that you talk about and advocate for and help support people through. And I really did not think it would come to me through the avenue of motherhood and childbirth. But that documentary, I think, like woke up a part of me that wasn't even willing to recognize it was there, because of how that fear we talked about, of birth, of motherhood, how daunting this role is. And I think looking back, that came from my own birth and then society's portrayal of it. And so, that really opened my eyes. And then it was kind of just no stopping me from there, because I felt so passionate about it.
I think it is. So my daughters, you have a daughter. How could we as parents, mothers, create a better conversation with our, either the people we're aunties to or our own daughters to make that a more empowered conversation? Yeah.
I always say, like, we have sex ed. If you're fortunate enough to be in a state or school, that's teaching you about these topics, but then we never have a class later, unless you sign up for one in pregnancy, that helps, you're like, it's like, don't get pregnant. And then, okay, now's the time, but no one's helping you unravel the fear and the the blockade around that. Yeah. So I think, making pregnancy not this thing. And I know it comes, I think, from it's well-intended, right? Like not wanting our teenagers to get pregnant, but it's all connected, by the way. Having an awareness of our understanding of our body, literacy around our body, knowing our cycles, like it's all connected to pregnancy, right? And we see this with birth control pills. It's like 16-year-olds who are like, my period hurts, or, this and that, or my acne, or birth control pill, right? And not really having conversations about how can we track the cycles? How can we look at like what your cycle is telling us as this vital sign? And so I think it can start young, not even around pregnancy, but really knowing how to take charge of their fertility and not wanting to get pregnant. Because what I hear from so many women is that when it comes time to get pregnant, they've been so focused on not getting pregnant, so focused on, stopping those hormones and that part of themselves. And then this overnight switch is really jarring. So I think just bringing pregnancy into the conversation, not as something that's right now, but as something that's not like, we don't have to stigmatize or make this like horrific thing that happens later. And then I'd also say for so many women who maybe are terrified of birth, like I said, we all have this part of us from living in this country, to be open if whether it be an auntie or a daughter comes to you saying, I want to watch this documentary about home birth, or I'm interested in having an unmedicated birth. I mean, the things you hear, which is don't be a hero, right? Or that's so dangerous. Like, we're so quick to have these taglines that I think we've heard from just the generations before. We don't know where they really come from. Maybe it's the media or the films, but to try and before reacting from our own place of fear, which is all coming from good intentions, I think, asking, oh, where did you hear about that? I'd love to watch the film with you too. And I think that in order for mothers and grandmothers to feel connected and to participate in this process like many other countries have and generations before us have, has to come with their work of doing exactly what we're asking the doctors and midwives to do too, which is just to listen and to honor that whatever you might want to do could be so different from what your daughter or friend wants to do.
Yeah, that's right. I think we should encourage women to forge their own path in every way.
And have open mind about different ways.
The other, I can, as a mother, expect my daughters in every way, in your profession, in who you choose as a partner, and how you want to approach becoming a parent, if you decide that's something you want to do. You talked a lot about physiological birth in the book and why that's important. Yeah, I think back to the hormones and how we're trying to override this process that, as we've discussed, has always contained risk, but it's always worked out pretty well because here we are. But we're trying to override that with technology, but we're seeing through the numbers that that's not actually working in the ways that we would hope. And so I really believe that honoring the physiological process, and then of course having the technology when we need it, I think that's the safest way forward. And when you really understand, and this is what I'm so passionate about in my book and in my classes, when you understand the hormones of labor, what's happening in the body, and you look at it, it's a divine miracle, but it's also just the most brilliant. Whoever invented this made no mistakes. Yeah. And there's a lot to that I think can also help us untangle. It's very common, like even in Brazil or here.
Yeah. Brazil has one of the highest cesarean rates in the world.
Well, that's what I was going to bring up. The C-section, right? Make an appointment, get the nails done, go get your C-section. It's not as inconvenient, the date, and listen, it's there for a reason. It can save the child or the mother's life. So thank God it exists. But what do you think is going on? It's just a sense of like, oh, we don't want to wait around anymore for you to finish labor, so let's just take this baby out. Do you think that that's why these rates are rising, or is it also probably a combination of we do sit around more? We are living further from our nature as we go.
Of why the cesarean rate is rising?
Like as we go into the position of birth, we're already not in a place of, women
being at their peak.
Correct.
Health.
And used to move around and walk around all the, time regardless and things like that. What do you think that is? Because now it's really commonplace. And if someone's listening, they go, well, what's the difference?
Yeah. I mean, I'm somebody who just believes that when we live a healthy lifestyle, we're putting ourselves in a position to succeed in everything in life. And that in itself is a commitment that's going to support you however your birth unfolds and your baby. And there's really no question about that. Yeah. I mean, we know, right, that like how we are pre-pregnancy, in pregnancy, and like I said, never too late to start is going to impact generations to come, which I find not to be stressful pressure, but actually like a really awesome
bridge
invitation. Yeah. That can really inspire to be at our peak health. But back to the physiology part, these interventions, we call the cascade of interventions, I do think are really what we're seeing in terms of the uptick in cesarean, Pitocin being one of the most widely used drugs, the most widely used drug in birth. And
those are contractions that normally you would never have that strong.
Yeah.
Actually, when I went into labor the first time, the nurse is like, I've never seen contractions as strong that weren't set by Pitocin. I'm like, that's awesome. Thanks.
Thank you.
Thank you.
Yeah. The Pitocin ones can really circumvent the design. But the difference is when they're, no matter how strong they are, is the hormones are communicating with each other, the receptors, right? And so when the body goes into labor and that the body's natural oxytocin is activated or released, the endorphins are too.
Yeah.
And when it's Pitocin, it's actually circumventing that
whole cycle.
the endorphin response. And so the pain receptors aren't responding in the same way. It's happening faster. And so even though they do try to mimic it by going low and slow, it can lead to distress for the baby with the intensity of those contractions. And so these interventions used to rush the process. And even if the body's not ready, something that people don't really know is that it's actually a protein released by the baby that initiates the start of labor. And so we don't really fully understand why, if it's like the lung maturation or like why a baby decides today is the day.
Yeah. And I can, like I said, I was very healthy during my pregnancy. I trained, I did everything. I ended up with Vi with a C-section. They were like, she's not dropping into, the birthing canal.
Yeah.
And now she's a little duressed. And because I remember thinking, I'm fine. I can push for another couple hours. And they're like, no, it's not about you. So there, in that case, was a tool that was helpful. And, did I feel disappointed in myself, whatever the thing is? Quite frankly, when they handed me a healthy baby, I was like, I'm good.
Yeah.
It I didn't expect that.
Yeah.
That wasn't part of the plan. I thought I was going to muscle through it. And that was the situation. So it's not about feeling bad. It's just about trying to pick sort of an optimum route, give yourself every chance first.
Totally. And I love what you're saying, because it's not that like cesarean is wrong,
no,
right? Or that there's one way to do it that's better, or this, or like that it should be any disappointment in it, but that women are just simply just honored in and met with that compassion in those situations without trauma, and met in however their birth unfolds,
it's happening,
with that respect and reverence for what that day is.
Yeah.
Right. And how beautiful that is. And so I've supported so many cesareans too. And I think that it's exactly what you're saying. Some women are like, am I supposed to feel bad? I'm like, if you don't know, not at all. Right. Like it's birth. Birth is birth. And I was born cesarean.
Yeah.
And I love this fact for anyone who's listening who is planning a cesarean, not planning a cesarean, but will have one or has had one or been born one. But breast milk, like remembering that one of the main concerns with cesarean birth is the microbiome, and that the baby doesn't get colonized through that. Yeah. But we now know that there is colonization happening in utero, which is cool. We didn't know that because we kind of considered it this sterile field.
I did have guilt,
Of course,
I always felt weird, like, I didn't push her out through all my real gunk.
Yeah, well, that's the thing where as we know more about
life.
But talk about the resilience, right, of life itself, of mothers, of children, but like knowing that nature is planned for this too. That's not the only opportunity for our microbiome to succeed in pregnancy. And then breast milk, and there's really exciting studies showing that breast milk for cesarean fed or cesarean born babies can completely help to restore the microbiome.
Yeah, so I can mitigate some of my guilt now.
Yes.
Just kidding. I always joke that in all the ways I've blown it as a parent, I'm sure, and I've been told and will probably continue to be told, I always think over Thanksgiving dinners, is I had the opportunity and the luxury, let me say this, in the world that we live in, to nurse my children for a long time. I will say this, the luxury. Yeah. Because there are women who they go back to work. So hats off to you. But I sometimes when I'm looking down the barrel of a 14-year-old who looks, sideways, I think, oh my God, at least I nursed them. Like you question everything else.
My sister loves to joke because she did all the nursing and this, and it was very similar parenting approaches to mine, where she really thought through everything, and then she just I remember whispering, and she's a bit older, so she has teenagers, and she was like, sometimes none of it really matters. They really just give you a hard time anyway. We joke sometimes. She's like, when you have teenagers, you're like, but I thought if I put you in my bed with me, or if we did this, then you wouldn't give me a hard time when you were 16. You're like, you know what? They're going to.
But that's part of nature too.
Yeah.
Self-identification, breaking away, separating. is them finding their way.
Yeah. And the foundation is everything. I do think that like when there's that foundation of love, when the mother is supported, like they have the freedom to go off and be themselves, to do those things, to make those mistakes, and know that there's a strong foundation at home.
And I often think if you do it right, they may end up in some way in a bigger life further away from you. They'll come back and connect.
Yeah.
But I sometimes think, if you really, then they might go even further away.
You mean like more attachment early on?
Yeah. Like that they go further. Yeah. So if someone's listening to this, maybe, and they get in a situation where maybe it doesn't work. The baby's not latching on, the mother's not making milk, whatever. Yeah. What alternative to nursing for you that you've seen that would be good? Because people do get into that situation,
of course,
for whatever millions of reasons. Just
like life and birth, we talked about, there's always exceptions to these rules, and there's always, and since the beginning of time, we've known that there's been issues with fertility, with birth, and with breastfeeding. But I will say, the breastfeeding rates today are lower. A lot lower than what they don't actually reflect the women who have a hard time breastfeeding. Right? We're seeing that,
what is that? They can't
a majority of women are opting out of breastfeeding past 6 months. Are they saying, hey, I have to go back to work, it's too much of a like? What are the reasons? I do think it's how our economic system is set up. I also think it's lack of support and education. So I guess the first thing I would say is setting yourself up for support to breastfeed if that's what you want to or plan to do. Yeah. Knowing the lactation consultants in your area, having a doula, really understanding what is going to best support you through that process and how you're going to sustain breastfeeding, having a plan and understanding for that. I also talk about in my book, and as you said, like the luxury of being a mother in this season. And that's something that is, I think, so many women struggle with in a time where women are expected to just dominate the workforce and be committed to their careers above all else. And so I talk about and write about kind of like having permission to pivot and knowing that won't always be forever, but sometimes that is required or helpful, I'll say, for breastfeeding, sustaining a longer breastfeeding relationship, but also know women who do succeed in breastfeeding as well, while also going back to work. But I'll say is that support, the nutrition, the nourishment is so huge. Things like co-sleeping, not right for everyone, right? But there are physiological parenting approaches that will help make that easier.
People always say, I'm afraid I'm going to roll over on the baby.
Yeah.
And I smush the baby. And I'm like, chances are you're not. But like you said, some people are not comfortable with that. I just personally got tired of getting up, like if you have them in a bassinet or a basket next to you, that's good. But I think people are afraid they have the monitor on and then the kid's down the hall.
Yeah.
And it's like, well, you're up anyway.
Yeah.
And them hearing you breathe, things like SIDS.
Yeah. Well, we know right, that the baby, as the baby feels and hears the breath,
they mimic it in their sleep. Exactly. And so SIDS is oftentimes they forget to breathe.
Yeah.
And so I think people, Laird always jokes, like if we lived in caves, you wouldn't have your kid somewhere outside. So I think even if people could be comfortable with having a baby next to them. Yeah.
It's a perfect example of the conditioning of fear.
That's what I mean.
Right? It is like one of the best examples of that, actually, because the Pediatric Association says we can't do this, we shouldn't do this. It's not safe. You hear it from your doctor. You hear it in the books, on the guidelines, and the pamphlets, and that trickles into social circles. But when first of all, there's a lot of misinformation in that. But when we just say, nope, that's not safe, can't do that, we're actually creating situations that are unsafe. Because the truth of the matter is many, many, many mothers end up falling asleep with their babies at some point because they're exhausted, whether they're nursing or formula feeding. Their baby is going to be on their lap if they're not in the bed and be in a position where they just fall asleep when they can. Yeah. And that is when co-sleeping is not safe, right? If they're in a recliner, on a couch, in a chair. And so if we teach women how to safely bed share with their newborn, with their infant, whether or not it's right for their family, and as a co-sleeper who loves it so much. I'm also have an almost 2-year-old where I'm like, oh my gosh, this is a lot. So I respect any choice, but knowing that there's neurological, immunologic benefits, so many benefits to co-sleeping, primarily the breastfeeding one. But we can also provide information and resources for doing it safety, because even if you're not planning on doing it, it's going to happen.
Yeah.
And how about setting those parents up to be in a safe situation when they do fall asleep?
Yeah, it's so true.
Yeah.
It's really crazy. Are there formulas though? Like, let's say somebody doesn't have it, nursing didn't happen, or they have to go back to work because that's their reality. Because formulas scare me a little bit.
Yeah.
Is there a sort of better brand?
Yeah.
Have you seen better brands?
Yeah, a lot of formulas do contain seed oils, which I know is a concern, growing concern. And there's certain regulations that like require that to take place. There are brands that are emerging with grass-fed cows, more organic ingredients. I know people have turned to European formulas for many years, just knowing that there are happier cows.
There's some happy ones in Switzerland, I heard.
Yeah. So yes, I mean, there are absolutely better options out there. Nothing that provides what breast milk provides, but absolutely we're in a time which is, I think many companies are filling in a really important gap in the marketplace to provide women and babies with cleaner, better options. And then there's also donor milk, which is not right for everyone, but an option as well.
Yeah. I mean, I love the idea of donor milk for a lot of people though. I mean, it's pretty astounding.
Yeah.
Think about it.
Yeah.
So you talk about the 4th trimester. Well, before we go there, actually, let's talk about how did you get the idea when you sort of talked about these kind of activities and things to do as you're moving through your pregnancy? What was the thinking behind that?
So I'm not normally like an avid journaler, but I was really good about it in my pregnancy. And I found that was like a place where I could really connect with my daughter and chronicle this experience and tune in. And, I'll say that so much of what I see within the way that birth is approached, the medical industrial complex, is, we've talked about this disconnect with the life inside, with this intuition as mothers. And I felt that in journaling and in doing some of these activities that I came across in my work, it just provided me this profound opportunity to connect with Lou and to, I would write letters to her. I would talk to her. And it was so grounding for me, because I think so many of us can relate that it's sometimes easier to mother someone else than ourselves. And I kind of use that as an opportunity to mother myself, like another really like invitation to like
coach your way
to help myself. Yeah. Through birth and pregnancy. And I even remember like in birth, I would just scream every profanity that has ever been.
Yeah.
And then in between that screams, I'd say, I love you. You're doing such a great job to my daughter. You're doing so great. I'm so proud of you. Thank you for working so hard with me. Motherfucker. Right. Yeah. I'm not yelling at you. This is, I love you. Thank you. And so it was just like, it felt so good in birth to have had this foundation throughout my pregnancy, and utilize many of these activities and prompts through birth to feel so confident in our connection. And every mother and child has this connection. But I do think that it's been neglected or not by the mother, but by the system as a whole. And so I was excited to create something, like I said, that like provides the information and the heady stuff, but really allows us to drop into the heart for a process that is just so divine.
Yeah. I wonder why we take something that does have that kind of perfect design around it, and then we as humans go, well, we know how to do it better.
Yeah.
I really always am so curious about where we think we can improve upon something that's designed pretty beautifully. And that's not to say there aren't certain things that, yes, they have been helpful. I'm not saying that,
of course.
But not to the point where we want to move so far away from the way it's designed to be. So you did break it up in first, second, third, fourth trimesters. In the first trimester, if we could sort of I don't know, like I want to say highlights. Like I almost think the first trimester, and I could be wrong, for me was like getting emotionally kind of like in touch with the fact like, oh, this is happening.
Yeah.
I mean, and that's to say if you don't feel really sick. I was fortunate that way. So for a lot of people, it could be like, hey, the first trimester, I just, needed to get through it because I didn't feel good. But I think for a lot of us, it's like, oh, it's the gearing up.
Yeah.
Because the body's going to change.
Yes.
All these things are going to happen. And sort of getting that emotional. I didn't go to the doctor with my first pregnancy until, I guess almost it was close to almost 3 months because everyone goes, oh, 3 months, don't say anything. It's like and by the way, it is not uncommon to have miscarriages. I had one between my first and second birth, to miscarry early in pregnancy, because that's what's so beautiful. The body knows like, hey, you know what? We're not everything is working. We're going to take care of it. So I waited until literally almost 3 months to go to my first doctor's appointment. And he's like, why did you wait so long? Because I'd taken pregnancy tests. And I said, well, everyone made such a big deal about 3 months. And so I thought I wouldn't get crazy. I was going to be healthy. Yeah. But I waited until 3 months. Yeah. But for you on these different kind of markers, what were the things that that you've experienced, but that also you witnessed that really showed up kind of as highlights for each one? That's
such a great question. I think exactly what you said, the first trimester being this time, which can be isolating for a lot of women who aren't sharing, right? If they are like keeping it to themselves. But, and I write this in the book, I'm like, if you need to share early to have the support you need, don't keep it to yourself because of this fear of the stigma around loss that we have. And if you want to keep this just to yourselves right now, because soon everyone will know. Yeah. And you can't go back from there, and everyone in the grocery store shop you. It is like a really sweet time of your little secret. Yeah. And I think a time where you can go inward before the whole world starts telling you their opinions and this and that. It's this. So I think there can be beauty in all of that. And so that first month, is like really just like the foundation of like things you can do to support your body at that time, and to work through some of the grief and the fear for those who have experienced loss or haven't, but are just, are really feeling that. Yeah. Whether it's the past grief of loss, but also like grief of what's to come. And I think that comes up a lot throughout.
People should talk about that. They should talk about like, my life will never be the same. Yeah. And it doesn't mean it's a bad thing and not something better is around the corner, but I think it is important to recognize that you feel that too.
Yes. Yeah, absolutely. And so we talk about that big
not like, oh my God, are you excited? It's like, and fuck off. Like, and totally I'm scared terrified. I'm never going to sleep good again for the rest of my life until, I'm joking.
No, but I say this all the time. I say birth comes with a death of the old self, a death of the maiden, of your relationship as you know. And there is such a massive grief that takes place postpartum. And that looks different for everyone. But I do think that's important. And there's like a lot of beautiful ritual that can actually come from letting go and shedding and like putting that version of yourself to rest, because she's never coming back in the same way.
She's definitely not coming back.
Yeah. So that was first trimester. Second trimester is, I think a lot of people get a lot more energy there. So that's where we bring in some more nutritional stuff and fun activities, and this opportunity to like look back at, the generations before you, really process like how your understanding of birth, and start to introduce some resources around choosing the right provider, the choices you have, building the birth plan into the third trimester. We get kind of into the nitty gritty of your choices. And then the third trimester, there's a lot of softening, because that's where another, I think, wave of anxiety can hit for women around this date and the anticipation. And as somebody who literally wrote a book about patience, I gave birth 3 days late.
You talk about forgetting your due date.
Yes.
You almost, I think that's right in the beginning of your
literally,
book.
Is ditch the due dates. Because our attachment to this date is such a I don't know if I can cuss on here. Mind fuck.
It's my favorite. I don't drink alcohol. What do you think I get a relief? Come on.
It's such a mind fuck to think of this date 6% of babies are born on their due dates. Totally meaningless.
Yeah.
I knew this. I taught this. I lived by this. But when I calculated, because I didn't do early ultrasound, I kind of opted out of the ultrasound thing. So
was it for exposure?
For multiple reasons. Yeah. Okay. But exposure being one of them.
What else? Come on.
I'm going to go and retangent. Okay. I did for
don't let everyone think you're just,
radiation exposure. Yeah. I did do a really quick one at 20 weeks.
I just felt like half the people glaze over. It's too much to handle.
Yeah. It's a lot. And it's in the book. I have a chapter on the book called, I think it's called Reconsidering Ultrasound. I can't remember all my chapter names, but it's a chapter on ultrasounds. Mm-hmm. I talk about why I chose to opt out of the routine ultrasound, my concerns with the research that we do have available, the lack of research we have available. And then I also bring in some personal stories from friends and clients that are just absolutely heartbreaking. And I guess you can buy my book to read those. But yeah, of just ultrasounds gone wrong. And we're not talking enough about the false negatives or positives that come up, or the false diagnosis, I guess I'll say, that come up from ultrasound. And then the great news being, 2 weeks later, we did another ultrasound, everything's fine. But the amount of stress that can arise, that we're acting like it's just no big deal because all is well that ends well, which is not. Yeah. And I've had, people be recommended termination later in their pregnancy because of what an ultrasound reading. Women prepare for a baby with an abnormal heart defect and all these different things that can come. And sometimes those do happen and sometimes they don't. And there's not enough certainty in it for me to felt comfortable with that information. And so what I chose to do at 20 weeks, and I don't know if I would do it again next time, was to gather some information to be prepared to make decisions on the other side of birth and have necessary resources.
You mean like blood work and such?
No, like if there was, God forbid, something that arose, that it wouldn't have changed the course of my pregnancy. I was 20 weeks at that point. And at that point, it felt for me and how I felt within the pregnancy, I knew that I wasn't going to change, that the pregnancy was going to happen.
You were in. Mm-hmm.
And so when I had the conversation with my midwife, which is another beautiful example of informed consent, right? Is she was not like, you have to do this. She was like, this is why you might want to. And it's not, because I was like, no, nothing's going to change in the information. She's like, yeah, it doesn't have to change your plan. It doesn't have to change anything, but maybe you could interview some heart surgeons, or some people so that you are prepared for what might have to come on the other side. But I was also very well aware that something could come up and not actually be there on the other side, which is everyone's hope, or that I could get a clean bill of health for her and something could come up. It is just a snapshot in time. And so I just think it's one of those technological advancements that has a time and place that can be really, really important, but is widely overused. And we haven't really discussed the negative implications that it has on many women and their pregnancies.
Yeah, I mean, there's even that about getting mammograms with your breasts.
Yeah.
It's like, you're checking for certain things, but yet the exposure is oftentimes more dangerous than what you potentially could be checking for. So what are the options? Yeah. I had my second daughter, or my third daughter, my second birth, I guess about 6 days for my 38th birthday. So I was 33 for the first and older. And so what I did is, because once you're past 35, right, they really want to poke you and test and see. And my doctor said to me, and again, this is very personal, so I'm only sharing it with you, but meaning if you're listening to this and you might choose other, you might need to know. That's okay too.
Yes. And we often talk about avoiding intervention, right? But I also think just in the same way that you should be able to avoid it, you should be able to walk on up and say, I have this feeling and I want you to check on it.
Correct. And so I believe in all the ways are right as long as you're doing it your way. Yes. And so I said to him, he goes, if I told you something, would it make it different in your pregnancy? And I was like, no, I'm going to have the baby.
Yeah.
And he goes, that's what I figured. So he goes, I'm going to do your blood. And if anything looks unusual there, we can revisit and decide. But otherwise I had no other tests, no snippets. Yeah. Nobody touched the baby.
Amnio, which no one really does as much anymore now. Yeah.
Because that was big when I was.
Yeah. Oh, yeah.
And that's dangerous.
Yeah.
And so I just remember thinking, there's, these choices that one has to make. And so you talk about the fourth trimester.
Yeah.
Because and by the way, you're not pregnant for 9 months. It's closer to 10.
Yeah.
I mean, I don't know who they sold that to.
Yeah.
Once
and
you get
it's
into
40, I mean, it could be anywhere like 38 to 42 weeks is his range. And that's why I put 42 weeks. I mean, some will go past that, but I was like, we expect everyone to kind of have their baby by 40 weeks, but
I didn't.
Some don't. Yeah.
My first pregnancy, I think because I'm long from here to here, just the way it went down, and it was my first pregnancy, they said I was, quote, 2 weeks late.
Yeah. But if you didn't do that, or was this for your second?
No, first birth. First.
But okay, I was going to say, we also, the ultrasound, this is another where there's a margin of error. There's not an absolute accuracy in ultrasound.
Right. What the nurse said when Reece was born was, I don't know how late she is. Her feet, you get peely feet. She goes, she doesn't have any of that.
Yeah.
So it's like, that's the thing. I really appreciated that. What about postpartum recovery? Because you look in the mirror and you think, okay, that person outside, if let's say you're with the father of your child, and actually, I don't care, same-sex relationships, unless you're doing it alone, which has its own other things that are really hard. It's like the dynamic between us is changed forever.
Yeah.
I have this person that I love beyond, but I will be taken care of. They don't forever. There's no off switch. And I have the impulse only to do that, and the daunting sort of overwhelming thought because I just gave birth 5 days ago. And that's why I always said, like, I tried to move as much as I could. So when I did look in the mirror, I thought, oh, wait, I know her a little bit. But what happens is all of it goes out the window.
Yeah.
For a lot of people, their hormones are off. They don't feel good.
Yeah.
Their bodies got, smashed in the process, at least temporarily.
Yeah.
What do you say to your people that you work with that, is a way to be supportive in the postpartum phase of this? Because pregnancy is one thing, having a new baby is another.
Yeah. And it's interesting. We have, like we were talking about the ultrasound, sometimes it's like obsessive desire to like check on the mom throughout birth, which can sometimes be a wonderful thing, right? If it's authentic support.
Yeah.
And then sometimes it's like, need to get all these tests and do this. But then it's like after birth, she has one visit at 6 weeks and that's it. And she's put it back on birth control and told she can have sex again. And that's like what our medical system has to offer. And so that I think is one of, we've completely, and other Eastern, this is back to the question you asked me about other countries and how they might do it better, but in a lot of Eastern traditions and specifically like in China, and I know within the Ayurvedic approach is this understanding and recognition that the postpartum period can either make or break the rest of the woman's life and her health. So there's an opportunity to actually heal the past of what she's been through in her medical history or her health, right? Like she can nourish herself to an even healthier body on the other side. Or if that's neglected, can
put her off the rails forever.
Yes.
Do you ever I think about this a lot. Like you'll always talk to people and they go, oh, my mom's crazy. And I used to go along with that. And then as I got older, I thought, no, childbirth took this person out and nobody ever found the way to
lack
support
of support
her back
postpartum.
to health.
Yeah.
And then it's like she left, she lost her mind. It's like, well, I remember reading a book about a woman talking about her hair falling out and things like that. And she was short, she was low in omega-3.
Yeah.
So how's a way to, let's talk about that support, because that is a big one. What do some of those modalities look like? Yeah.
So I have to plug my friend's company, Little Honey Money, which is, I rarely get like this excited about something that has come to be, but I do think that this conversation is really challenging for a lot of people who maybe don't have the resources or the support. And so they're like, I hear what you're saying, but like, how am I going to do that?
Yeah.
But what Erica's doing at Little Honey Money is trying to reinvent the baby registry. Right. And so this understanding that we don't really need all these gizmos and gadgets, but what a new baby needs is a well cared for mother. And so some of these modalities, be it pelvic floor support, massage, Abhyanga is a Ayurvedic kind of like lymphatic warm oil massage that is so nourishing and supportive to the nervous system. Therapy, couples therapy, postpartum doula, nourishment, food, you name it, right?
Do you think postpartum oftentimes is just a nutritional deficiency?
Postpartum depression, you mean?
Absolutely.
Absolutely. I think that, not all the time, but the fact that that's not something that is immediately addressed and ruled out is, I think, unforgivable. Mm-hmm. We know, and there's research around like the brain, like you said, omegas, fats, proteins. Also, just anecdotally, if you see me on a day that I don't have lunch, I'm not well. And some people can do that better. I don't. Like, I'm not even joking. Like, I'm not making light. Like, I feel it. Like, I'm one of those constitutions. Like, if I'm not well nourished with healthy food, not well. Yeah. I'm not. And so I like, how many studies do we need to prove that? How many studies? Like, no, listen to my body. Like, I know that is my source of well-being. And that when I have the protein and the necessary fats and good food for my fuel, sure, motherhood still throws things your way and we still have a bunch of other factors and hormones and predispositions, but I feel so much more equipped to handle what comes my way. And so again, it's like, is it studied? Is it not? But like, let's ask ourselves, how do we feel when we're well nourished?
Yeah.
We know.
Again, this goes back to all of sort of the healthcare, which is we really don't value that food is medicine.
Yeah. And that should be the first stop before anything else is getting that mother well fed and nourished and supported, right? In a way that, and then I do think that would absolutely improve the numbers of postpartum depression, anxiety that we see. And then of course there are mothers who do have all of that and are still struggling. And there's a lot of different reasons why. But I talk about that in the book, that I think the way that we perceived motherhood and treated it and treated mothers plays a huge part in what we're seeing.
I think it's certainly been the most powerful experience of my life. But what I always tell my friends who choose not to do it, I'm like, I'm not going to sell you a false bill of goods.
Yeah.
You're not a happier person because you have a child. Mm-mm. And I think that this is important because sometimes women go into thinking they're going to have a baby and somehow, is it rich? Is it like the depths of love beyond? Of course. Will you be happier? That's not what it is.
Yeah.
And somehow we've put all these things like, you put it in a box and you control it and you organize it and get back to work and everybody's dressed perfectly and the relationship goes back to the way it is. And I think the more you can have conversations like in your book, in growing together and even connecting with your child sooner, right? Because you're going to be going through this together, I think is just a really important reminder. So I sort of wrote down, I was like, okay, what are the things that really stood out for me? And first for me was trust your body. This book talking about trusting your body, yourself, so that the fact that let's be reminded it's a natural process.
Yeah.
It is. And getting women back into trusting their bodies. What if someone goes, yeah, great. After college, I worked for 15 years. I haven't looked up. Do you have ideas about inviting women back into that communion with their bodies, with their nature?
Yeah. I think it doesn't have to be massive. It doesn't have to be everything overnight. Mm-mm. We talk about even like things as simple as like grounding. And in that third trimester, I talk about, after I get into the heady stuff, actually just softening into the less heady stuff. Just really slowing down, which I'm in constant practice of. It doesn't not come naturally to me to slow down. And so that being a huge part of it, just the little baby steps and bite-sized changes that we can make, whether it be nutritionally, walking, right? And then I think ritual is a really beautiful part of that too. And that's how we can bring in community and create more ritual. And I talk about baby showers, even changing like how we plan to show up for ourselves and ask our community to show up for us, and how we can like we're so void of ritual in our culture.
Yeah.
And so the birth blessing ceremony that I talk about is this idea of, instead of it being about stuff, being about connection, whether that be with yourself, your community, and your baby. And it doesn't have to be everything overnight.
And I think for the partner that is not carrying the baby, they're supposed to be supportive and all these things. But I think it's also important if you're the mother to include them and make them feel included, because sometimes they get alienated. They congratulate her. They don't congratulate him.
Yes.
He's meant to be understanding, but they're going through it too, differently and not as obviously. And so I would remind people that the more you could include them, I think the more they would participate.
Absolutely.
And support you, because they would know how,
yeah.
instead of, it only being about you, but trying to figure out all the realistic ways to draw them in.
Yeah. That's the thing that I think excites me most about the future, is I would work with so many couples, and I love my dad. He's an amazing dad, and he just turned 80. So it's just a very different generation.
Well, they parented through the mother. They didn't parent directly.
Yeah.
And so I think that could even start in the pregnancy.
Totally. And my dad is just like the most there for you dad, but in just such a different way than the men that I'm seeing now. And it just excites me so much to see how fathers are participating, be in the pregnancy and the fertility process and the postpartum portal and in parenthood. And it just makes me really hopeful, because I often say to them, in the 1960s, I might screw up this fact, but 1960s, I think it was only like 16% of men were in the birth space when their children were born.
Oh, really?
Or even present. Yeah, they'd go out to the bar, something like that, right? Or, get a cigar. And so I always start my classes just being like, it is so exciting to me that like you guys are all here and just really excited and ready to show up for this process and feel involved in it, because you are an equal and different way, like part of this creation of life. And so that always excites me.
What if you're working with a woman and she says, yeah, every night at 9:00, I get a craving for Ben & Jerry's. We see this. I mentioned it earlier a little bit, that pregnancy sometimes is like a card. How do you have the conversation around the long-term? And is there a substitution, one for the other? Because again, it's like treat yourself well, but then it's not the cause for all discipline to be abandoned.
Yes. I mean, breastfeeding gave me a huge sweet tooth. So I have like a lovely relationship with sugar right now, which is more than I've ever had before. And I often tease like, it's because my body needs it, because I'm producing so much. Breast milk is so sweet. And I'm like less afraid of it, I think, than ever before, in the right ways, right? And when we talk about balancing our blood sugars, it's about insulating sugar or foods that turn into sugars in our bodies, carbs, with protein and fat. And then also being really cognizant of the source. And so in my book, I have a recipe from my friend Noelle, which is a homemade ice cream recipe that I love. And so, maybe making homemade is way easier than it sounds. Maybe that's not for you, but I'm not going to rag on Ben & Jerry's, because I think they're one of the better ones. And they always have a spot in my heart. But a lot of conventional ice creams, they have a lot of ingredients that are, and fillers and things that are stabilizers or whatever, that are not safe and healthy to consume. Dairy, it's important to be sourcing good dairy. And so I think that treating yourself and enjoying and listening to your cravings. And I often say, if you're craving ice cream, maybe you need more calcium. And how can we bring that in and honor and listen to our cravings, and also find joy through food, which I'm a huge foodie. So I love not limiting myself, but I always try to source the best possible version of what I'm craving.
Yeah. Did you ever think you were going to be so diplomatic, Carson?
Am I?
Oh, yeah. Yeah.
I didn't think that I would be so
empathetic.
No, like I think comfortable. I've gone through so many iterations in my food and like nutrition. And so I guess I surprise myself a little bit with my like leniency, I guess is not maybe the right word, but I'm in a place where my relationship to food is less fearful than ever. And it feels really good. And I feel the same way with my daughter. We feed her really well. We're so fortunate. We cook most of our food at home. We get the best food from the farmer's market. I grow a lot of it in our backyard. We get, cows from our friend's farm who she's literally raised from, a calf. Like we're so fortunate. but then also like I would go get for ice cream all the time, and she's 2, but I let her enjoy things that I enjoy too. And that surprised me because I have been really dogmatic about food in the past, but it feels right to not so much.
You are, and people may or may not be able to sense this. You do have an intensity to you, and kind of almost it's this interesting mix of very brave and direct, and also scared. Like concerned. So how do you, as a parent? I'm so curious because you're diligent, and fierce and strong, and then there's a part of you that's like a little more, and I think it comes from an alertness.
Totally.
So how is this showing up for you, and how are you managing this when you had a baby, and now she's still a baby. She's not really a toddler. Is that a toddler? That age?
Yeah, she's almost 2.
Okay. Well, that's still, to me, still feels like so little, but where do you go within yourself? What tools have you developed to kind of live and manage between those feelings for yourself?
I did, I've struggled with anxiety in my past because I totally have that tendency, as you know, like I can totally go there. And there's been a few different things that have been really supportive of me. One is cognitive behavioral therapy. When I was in college, I came across an amazing therapist when I was really struggling, and she just gave me these really straightforward tools, some of which I talk about in the book, of just like getting back into the present moment. So that has been huge. And then some of it has also been like a deep spiritual work. And not like I'm saying I'm doing something fancy or have some sort of secret or anything like that, but there have been certain opportunities and experiences that I've had with people who have been able to really like help shape my life, and I, there's a woman named Jan Birchfield who I really admire, who hosts retreats, and I've gotten to work with her. And I think through her like shamanic work, like I've noticed a humongous transformation in preparation for pregnancy. And so there was things that I really tried to work on before getting pregnant within our relationship, right? We talk about it just being like with that grief and change of self. And so that's been really helpful. And of course, those parts of me are still very much there with the anxiousness, and I'm constantly working on that. But I do think that, I let my daughter like really lead, and I have a lot of trust in her, and not lead. I mean, she's 2, but to a certain extent. Yeah. And that was a gift that came up in my pregnancy that I'm not exactly sure where it came from, but I do think it might be just from her. And I always say like our children are our teachers, and with that comes, and I do think that growing together has a lot from her in it. Like I have to credit her. And there was a certain level of trust that just came into me when I became pregnant, and I'm not exactly sure why. There's of course like work that I put into it, but I also think like her soul is helping me as it should be.
Because I think it's important for people to realize that the whole thing is always going to feel a little scary.
Oh my gosh.
And that's okay. So
oh my gosh, and that is part of the rite of passage, and I think is being. And we talk about those as our tigers, is being in relation to them, acknowledging them. Yeah,
it's easier. Don't shove those down.
There's no such thing as that.
No, they're coming.
They come. Yeah.
You talk about circumcision in the book.
Yeah.
Do you want to? It's something I had to go through. It's so funny. I thought about it. I was like, oh, I wonder what I would have thought or done. Because, it should look like their father, or for cleanliness, or all the million reasons that we've either been told. Yeah. What do you feel about that?
Yeah, the book has a really good chapter on this. That talks about the emotional and implications, and also the evidence that we do have. Evidence-based birth is another wonderful. I've mentioned them a few times, but they have a really in-depth article that does break down the research. So for those who are choosing circumcision based on the belief that it is cleaner or some sort of like safer option for their child, this article really helps those parents to understand that that is not really what the evidence fully shows. And there's a great film called American Circumcision that does the same. So with what we know from that research, we actually know that it is a strictly cosmetic procedure at this point, which kind of gets into the emotional choice or even the religious choice of it. But I do talk about in the book that like the foreskin has more nerve endings than any other part of the penis. Circumcision severs about like 20,000 nerve endings, which is just, it's just things that we don't talk about or really know or understand. And so I walk parents kind of through the information that we have around it and the emotional part of it, because I hear reasons for it is religious. Coming from a Jewish family and being very proud of my Jewish heritage, there wasn't a lot of things we were expected to uphold within Judaism. Like we practice some beautiful rituals and holidays and certain meals, but I just often had to ask myself, like, why this one? Because there's like a whole list of Jewish rituals that we don't do. We don't do most of them. And so I just, I invite people to ask themselves that, right? Like, why are we willing to give some up and not others?
Are you doing that like at Shabbat dinner, or when are you doing that? Are you bringing that question up to the family?
We don't even do Shabbat dinner. That's what I'm saying, right? Is like, why
Passover.
Yeah.
Are you bringing it out to the oldest member of the family? Like, why are we?
Oh yeah. They know my feelings on it.
Does anyone have any? They don't know. They just follow the rules.
Yeah. I think it comes back. I think tribalism, as we often talk about this, is so strong, the desire to fit in. And I also write about this in the book. If there is a magic wand as a parent that I could wave to guarantee my child never got made fun of, never got hurt, I'm waving it all day long, right? Like I read about this in the book. Like I totally empathize with parents wanting that for their sons. But if I wouldn't get a nose job for my infant if I felt that was different, or there's just other thing. Like I think we have to also acknowledge it as a cosmetic surgery that is a choice and is a voluntary cosmetic surgery that we're imposing on our sons with risks, like any surgery has potential setbacks and trauma. Yeah. So I do think that like I totally get that, but I also less and less people are choosing to circumcise.
I was going to ask if the rate was going down.
Yeah.
What was hard for you and you were most nervous about writing about in this book, but you knew you were going to anyway?
Yeah, I think circumcision is definitely a big topic that I think also being a woman, you're like, do I have a place in this conversation? But I think as mothers, we do. And I also just want to say on that note is I think this often becomes a thing that is just the father's wheelhouse. Like mothers are like, I don't want to do it, but it's up to dad. But I think it's a beautiful invitation, kind of coming back to that, to work through what so many of the things we talk about in the book, which is why we feel we have to do what was done before and how we can rewire. So that one's definitely like, yeah, that's a hard conversation to have, but one that I feel very passionate about. Another one, which we talked about, is the ultrasound. Because even though I do feel very confident in my choice, I really understand why there's a really dogmatic obsession, I guess, for lack of a better word, with this ultrasound, because it really connects to this sense of certainty that we're so desperately trying to attain on all levels, not just a doctor, we all want it. So I really sympathize with that. And so it's hard to write about that because it is a newer, and it's not a new conversation, but it's one that hasn't gotten a lot of airtime.
Yeah. Well, and I imagine there's just a lot of pushback. People look at it as a way to be safer. And
there are situations where it may, it has.
Yeah, but I get that it's hard to put your toe in the water on that because it's the norm. Can you just share, and I did this a little bit, but when you have a child, you're talking about the uterus setting back into place. And for people listening, there are options after you have the baby, a few weeks especially if you've had a C-section, where you can get massages to kind of help set the uterus back and in a little bit. So I think the idea of even maybe, because you could meet with a doula and get this information usually from them. But I think it's sort of reminding people that they don't have to accept, because a lot of women think, oh, well, that's just, I have to feel this way or look this way. And that's just how it is because I had a kid.
Yeah.
And there's always going to be little changes. Listen, that's reality. But I think that there is more support and more things you can do that are natural.
Yeah, that people don't know about.
Yeah.
I mean, we say like the jumping on the trampoline or sneezing, right? You're like, well, I had a baby, so I'm just going to pee whenever I do those things.
Yeah.
But it's like, no, like there are pelvic floor therapists and many who take insurance even who can support that. Like that is a signal your pelvic floor may need support. Yeah.
Do you ever have talked to women, because I've talked to some doctors, they talk about women not being able to have an orgasm after having a child, and you're really pissed.
Yeah.
So I don't think these sentences are not permanent.
Yeah.
So
pelvic floor therapy can be really
helpful with that, right?
Yeah. And even like embodiment practices, I think, I'm not saying it's just in your head, it's mental. Sometimes it is literally like a trauma from birth. But I also think for so many mothers and fathers, like the experience, like just you're tired. It's different. The connection is different. And so there can be like emotional practices too, I think, to support that.
Yeah. Was there anything, I think you had a funny experience during your own childbirth. Was there something that you were like, oh, now I know what they're all talking about, that really that showed up for you? Oh yeah.
I mean, I'll just say that, attending over 100 births, I was louder and more. There was, you would not think I was a doula if you saw me give birth but I also talk about this in the book that I think that was a profound part of the process for me and the shedding, and something I needed to feel totally comfortable moving through and doing, and having no, I didn't hold back in any way. And I felt so fortunate. I was just with my husband and my midwife, and I felt really safe to completely unravel and go to my edge and let it all out. Because I really did. There was no orgasmic birth. Zen.
Oh, that. I want to hear that.
And oh yeah, like I've attended those. I will tell you.
You have?
Oh, I've seen women give birth and they just look so blissful and beautiful. And it's just, that was not me. So yeah, I was certainly humbled by the whole process. I think I bit through Jonathan's skin. Like it was, but it was amazing. Yeah. I can't wait to do it again.
Recovery. Sometimes you'll read and people can't always control it, but it does take the body almost 2.5 years or so, right? Is that maybe, if you're going to be pregnant and nurse for a bit, that there is a time period that if you can, that recovery is helpful.
You mean before another pregnancy?
Yeah.
Yeah. I get this question a lot, and I don't really know exactly how I feel about it, because I think for me personally, it feels right to have more space. We want another child, but I don't. I'm not
judging if people bang it out, or that whole notion of like, haha, they said you couldn't get pregnant when you're nursing. No. Like, oh, okay.
Not about judgment. I'm just saying, like, physically, like I think about it a lot for myself.
Yeah,
like I'm like, am I ready? Is my body ready? Am I, and so I just think it's so person to person. It's so unique. I'm like, will I ever, like in 10 years, like when will I really feel like that? Because as a mother, you just use your body and mind so differently.
Yeah.
But I have some friends who feel amazing, they're just one after the next. So, in terms of like time, I also, similar when people talk about age, right? I think it's so much more like you could wait 16 years between kids, but if you're not nourishing yourself well, if you're not well supported, well rested, like all of these things, you're still not in an optimal state.
Right. No matter what you're doing.
Yeah. So I think so
it comes back to really, the great news is it's not an inconsistent message from what we're selling if we're trying to get you to take good care of yourself, which is your food, your movement, your state of mind, your spirit, your connections, your sleep, your hydration. I use dark beer when my milk was low. I'm not a drinker.
Yeah.
And Laird would get me Sam Adams or Chimay, very fancy, to drink because of the yeast.
Yeah.
But really for nursing, it's sleep and hydration mostly. Is that safe to say? Is there other things that are really supportive if the milk is
Yeah. And I mean, I also like to say like with sleep, sleep is an important pillar, but like you might not be getting it in the beginning.
I didn't
and
sleep for 2.5 years.
I know. I'm like, I'm still not going to sleep and I have plenty of breast milk. So don't feel, right. Like, oh my gosh, if I'm not sleeping well, I'm not going to be able to breastfeed. Yeah. It's more so like the stress and not back to the support, right? And I talk about this in the book, like I do feel like I was able to sustain a lot more sleep deprivation simply because of how well nourished I was, supported in all the other areas. Skin to skin is important. And I will say it again, like I do think that sharing a bed or being in close proximity with your baby in those early days and weeks to help your milk supply and allowing them to nurse often because it's supply and demand.
Yeah, I know. I used to say it was just like a human pacifier for a bit.
Yeah. I'm still there. I'm working on that chapter now.
Oh yeah. Did you ever do it in the car seat going down the freeway going 80?
I mean, I'm like washing.
We'd be driving and I'd like hang over the car seat. I mean, I'd be dead. The kid would be safe if we got into an accident. But it's literally, it's insanity.
It's insanity. I'm at the stage now. She calls it bitty, which I don't know where she got it from, but it's hilarious. But I will be reaching over for something and she, bitty! and just rip it out of my shirt and be nursing, while I'm just in motion. I mean, we're working on some boundaries. Better late than never. I think that it's equally as important for fathers to face and address and voice the fears that they have too, the needs that they have too. And I'll say specifically in that postpartum era, we hear like, oh, we're good. We don't need anyone because I like to cook too. Or I'll walk our dog. But setting up and planning for that sacred window, that postpartum period to before, have a plan, talk about your fears about the birth, talk about your fears about postpartum, about what that grief that comes up for fathers just as much as mothers, work on that, address that, give light to it. And then in that postpartum period, really plan to, if you can, take out as much time of work as you can to also be present in those early days and weeks and to be of support, but make sure that you're planning to be supported as well. Because I think one of the most beautiful ways that a partner can show up after birth is in their stillness, in their presence, in their recognition, and in that softness. And so sometimes when the father is expected to do all of the other things, they can miss out on that. And so there's a lot of service that will be done by the fathers regardless, to the whole family, but setting up the whole family to get that support, not just the mother.
And then it's always interesting because, Laird would say to me, because I liked the quiet. I was fine with like, hey, please go live a little bit. And he always used to joke and he'd say, well, if I could give milk, I'd be worthy, joke around about all that. But then the other conversation that's hard to have when you're a couple and you've got a new child is when you can have sex. Mm-hmm. And so I think that people need to be able to talk about that too. Yeah. I mean, not to be gross, but I probably was happier to give a blowjob before I wanted to have sex. But I also understood that there's needs. Yeah. And women can be like, I'm tired. I smell, our friend Janet, her husband, who since unfortunately has passed, he had the best line I've ever heard. He said that they had like a 3-year-old and a newborn, and that it's like probably had a dog in there somewhere. He goes, our bed smells like a manger with like diapers and mother's milk, And so it isn't sexy. Yeah. And the mom's like, I'm tired. Take a look at me. I don't feel sexy. But I think it's really important to just at least have a dialogue. Yes. That's all. It doesn't have to mean like we're having sex, we're doing anything. It doesn't mean any of that. It just means everybody feels like they can still say what they're feeling, because the thing is we feel it anyway. So if you're a new mom and then all of a sudden you are worried about your partner, at least if he's like, hey, it's cool. And when it works for you, yes, of course I would like sex, my doctor was sort of like, well, your uterus might still be open, but just wear a condom. I thought, oh, that's weird. But yeah. So
this is like a whole other area too, that's just so not talked about and around. Yeah.
Talk about it.
Yeah. Yeah. I think that like what you said too is just like the intimacy part being so important. Yeah. And something I tell my clients is that what is it, like love language or something, love signs or something, is like understanding like the ways that we once gave and received love will look different physically.
Yeah. And of the love languages don't change.
Yeah.
And if your baby takes a nap, you might want to
No, and I'm not saying that changes as a need, but the when and the how and the where and the what, like just, and some relationships more than others, that being a really, really important one for some like women, like that's what they need to feel seen and recognized.
A new mom?
I have clients who
horny, rowdy new mom. I like it. Or she feels wanted, needed, and loved. Desired, touched, right?
It doesn't have to be like sex.
Okay. Note to men. I will tell them how they can support.
Yeah, I think on both ends, right, is like feeling
just
seen.
Talking about it. Yeah, that's right. Carson, this book is so thoughtful and so well written and such a guide. That's the thing. I love when I have books that are, they're also workbooks. It's like having a friend or, a parent they're really helping you with just some food for thought. And it's encouraging people to have the confidence to do it in the ways that feel good for them.
Thank you.
I think I think that's so important because this is already in itself as magical, and it is a miracle. It is the unknown. So that makes it scary.
Yeah.
And I think it's important when you have advocates saying, hey, here's some ideas and thoughts, and it's okay to stand up for yourself. And here's alternatives to the things that are being presented to you. And I just really appreciate this work. So besides, are the courses still available?
They are.
Okay. So they're available and the book is available. Is there an audio book?
There will be.
Okay.
But I think the book comes out first and then audio.
Okay. I think the book, it's good to have an actual.
But there will be audio.
Is there any last invitation or something that I really missed, because I'm sure I missed so much, that is important for you just as far as like your message and why you were inspired to do this in the first place?
I mean, I love how much you read the book, because I can tell and feel from all your questions that I feel like we covered so much. I mean, it's so fun. This is my first book conversation, and it just feels it's so wonderful to like be in conversation with. You're one of very few people who's read it so far. But yeah, I think to just echo what you said and read from the book, which makes me so happy that message came through clearly, is that it's not about, doing it a certain way so much, but I hope that this book allows you to, maybe have an open mind to ways that are different beyond what may just be within the periphery of what we are seeing or think is available to us, and to honor this really special and big and intense time, and how your family can best approach it on their own terms.
Yeah. Thank you. And I was thinking when you were talking about if you were going to choose your OB or your midwife, do you think it's instinct if you ask these questions and it feels like you could be on the same page as your midwife or your doula, your OBGYN, that's sort of a good indication that, hey, this could be your person when you're interviewing people? Yeah.
Questions are really helpful. And in the book, I have, an outline for that, but just paying attention to the way that they talk to you. And we all say the wrong words or this and that, but it's more, when you ask something you're not allowed to, right? If you hear things like you're not allowed to, or you can't, just kind of keeping an ear out for the way that your provider approaches you. Midwife too, doctor and midwife, are they recognizing your sovereignty? Are they practicing informed consent? And that's as simple as, the difference of, we're going to do this test today, or there's this test that offers this, and this. Mm-hmm. Here are the risks. Here are the benefits. Do you want to do it? Right. And that's actually kind of hard to come by, to find somebody who takes that time and the limited time that they have. But someone who is really reminding you that you're in the driver's seat.
That's right.
And comfortable with that.
Yeah.
And trusting of you. And I know because of how our healthcare system is set up that it is really, you're lucky if you get 15 minutes at a prenatal, but not settling for somebody who isn't going to really listen.
Yeah.
Yeah. And be there for you.
You've used the word sovereignty about 4 times in this interview. And I always say, if I could teach my daughters anything, it would be to keep their sovereignty intact.
Yeah.
so important. And that's for everything. So,
Yeah.
So Carson Meyer, thank you.
Thank you so
Growing
much.
Together
Gab.
is the book. And congratulations.
Thank you so much.
It's a lot of work. Thanks everyone for listening. Thanks everyone for spending some time with me. Hopefully you got something out of it. If you did, feel free to share it with your friends, and don't forget to like and subscribe. And also, I want to hear from you. Tell me what's working, what's resonating with you, and how you're getting it done. Keep going.